Good evening and welcome to this virtual board meeting of the Board of School Directors of the School District of Springfield Township for this evening, August 18th, 2020. And I want to welcome everyone to the board meeting tonight. I want to express my thanks to the parents, the students, and community members who took the time to write to me and to the board as a whole to share personal stories, opinions, ideas, and information. I believe that all of this information has helped us to more deeply understand the challenges our community is facing as a result of the pandemic and the great concern that we have for our children. We all know that Springfield Township schools are at the center of this community, and that has never been clearer. We do have a record number of attendees signed on to this meeting, and there are two places for public comment in the meeting. Once early in the meeting for matters that will pertain directly to the items on the agenda this evening, and then again after the board has reviewed and voted on all the items on the agenda. There's another time when comments will be heard on general matters relating to the school or board issues. While everybody who is on the call may not want to speak, we really want to make sure that those who do can be heard. So as was our protocol at the last meeting, we'd like to try to allow for about 3 minutes per person, and we ask for your understanding if we need to limit your time. As there are questions, we might be able to respond to those extensive response. We'll make note of any questions and be sure to get back to you. We do have guests with us this evening, and after roll call, I will introduce them, and there will be a brief comment or a brief Q&A after their speech also. Could we have a roll call, Mr. King?
Mr. Bedard.
Here.
Mr. DeFranco.
Here.
Dr. Atlin.
Here.
Ms. Jordan.
Here.
Mr. Lapidus.
Here.
Mr. Needleman.
Here.
Ms. Sarsfield.
Here.
Ms. Lipinski.
Here.
Dr. Taratusky.
Here. A reading of the mission statement. The mission of the School District of Springfield Township is to educate and develop all students as learners and citizens who are high achieving, resilient, and responsible in a changing global community. Our guest speakers this evening, who we're very grateful to have with us, are Dr. Susan Coffin and Dr. Meredith Matero, both physicians at CHOP. Dr. Coffin is an attending physician and associate chief of the Division of Infectious Diseases at the Children's Hospital of Philadelphia and a professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania. She is actively engaged in the clinical care of children with infections, research on the transmission of infectious diseases in healthcare and community settings, and teaching of medical students, residents, fellows, and other care providers. Dr. Matone is the scientific director of the Policy Lab at the Children's Hospital of Philadelphia and an assistant professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania. As a public health researcher, she engages with the city and state agencies on the evaluation of child and family-focused programming. We want to welcome Dr. Coffin and Dr. Matone, and we'll allow them some time to share their information with us. Thank you.
Hi, everyone. This is Susan Coffin. It's a pleasure to be here with you to share with you a few of our insights from Children's Hospital's Policy Lab about where we are with understanding this outbreak of coronavirus, children, and the complex communities that schools represent. What we thought we would do was each make a few comments and then leave a bit of time for question and answer. And we're happy to provide any additional materials if we don't get to address all of the concerns. I think the big messages that we want to share with you tonight are that to open schools successfully and in a sustained fashion, we really think there are some key ingredients that a community needs to have. We're seeing that over and over again as we watch the TV news, that as schools open prematurely without having all of their stars aligned, that they may in fact fail to keep their schools open. And we all worry about what it means to open and then very quickly close, about the ultimate experience of children during the school year. So what is it that we think is important to have in line before you open a school? One is really good control of the virus in your community. And we've written some guidance that's available, and we'll share with the board about what those thresholds might be. But it is lower than where Delaware County is now. So to give you an example, Delaware County currently has about 80 cases for every 100,000 members of the county. What we're aiming for is to open schools with no more than 10 cases per every
Susan,
100,000.
I apologize for interrupting, but I just wanted to clarify and make sure you understood that we are in Montgomery County and not Delaware.
Well, I'm very glad you corrected me.
There's another
clearly need to work on my
Springfield.
Geography.
There is another Springfield in Delaware County, and that's a common mistake that folks make. But we're Springfield Township in Montgo.
Okay.
Sorry
Thank
to
you for the
interrupt.
correction. I'm a bit embarrassed, but I'll continue on. I didn't prepare to share with you what Montgomery County's numbers are. I do know they are better than Delaware County's.
I have it,
This
Susan.
is a
I can.
competition.
Yeah.
Okay, great. Meredith will save me. At any rate, let me real quickly continue and just give you the big picture, and then I'll turn it over to Meredith, who can really help us out with some of the more fine details that I've clearly not mastered in terms of where we are. So viral control in your community, super important. Having a really good and robust safety plan with appropriate resources in place. And that means appropriate resources for masking of teachers and students, appropriate resources for maintaining appropriate distances. We're shooting for 6 feet, not 3 feet, as the WHO has suggested to some, but 6 feet. And then appropriate resources in terms of hygiene, being able to clean surfaces and hands with increased frequency than what we have been accustomed to doing. And then the last ingredient that I think it really is going to take for successful school opening is confidence. Confidence amongst the teachers, the staff, the students, and most importantly, the families and rest of the community. This really is a team effort to open schools and to keep them open during this very challenging time. I think what we're learning is there is all sorts of concern, but there's also all sorts of commitment to help make this happen for our children. I think what I'll do is pause here and let Meredith share some of the specifics about where we are in Montgomery County, as well as how we at Policy Lab have thought about using some of our data to guide some decision-making that is on the horizon for all of us about how to move forward with school reopening. So Meredith, why don't you take it away?
Sure. Thanks, Susan. And hopefully everyone can be sympathetic to the fact that we've been doing quite a bit of these multiple days in a row. So we'll keep our geography straight, but it would be really embarrassing if I didn't know where we were tonight, since I'm a resident of Springfield Township. So, in terms of what I'll cover, I would like to spend just a few minutes talking about sort of the trends of what we're seeing, where we are in Montgomery County, and then sort of, as Susan mentioned, how we're thinking about what that means for safe reopening. In Montgomery County, we are doing better than Delaware County, but we are seeing a concerning trend that we're seeing in many counties across Pennsylvania, which is really acutely in the past 2 weeks or so, a turn towards a rise in cases. We've seen, for example, 46 new cases in Montgomery County that were identified today, and over the past week and a half or so, sort of a sustained elevation in new cases, and a rise in what's called the case incidence, which is the number of new cases per 100,000 person in the community, that has risen from 29 to 36 per 100,000. And so you heard Susan reference that really what we are aiming for is about 10 per 100,000 for what our assessment is of a safe level of community transmission for sort of full school reopening for in-person schooling. And really, we have come to that assessment both from watching what has played out in schools that have opened in this country, largely in the South, that have opened without good community control. And I'm sure any one of us who has turned on the news at any point in the past week has seen the lack of success that those school openings have had. But really also sort of the contrast of opening with high community transmission here in this country with what we've observed with school reopenings that have happened in Europe and in Asia that have happened with very good community control, and the contrasting success of those reopenings. That coupled with work that we've been doing for the past few months, really projecting out and modeling trends in community transmission, has really led us to feel pretty comfortable that the safest reopening would be sort of a sustained rate of community transmission at about that 10 per 100,000. And can talk just a little bit about that modeling, and happy to share those resources that Policy Lab has been doing, really projecting out the next 4 weeks of what community transmission has looked like. And in doing that for the past few months, what we've really, I think, been able to get an eye for is what is the level of sort of rise in spread that really precedes unmitigated spread within a community. And I think while we're not there yet in Montgomery County, sort of as we assess what's happening in Pennsylvania and the region, we're seeing a trend that is concerning because it's a trend that we've seen in other parts of the country that has, in other parts of the country, preceded sort of a sustained growth in cases in a region. And so that is particularly concerning to us. And the other factor here is that we have Labor Day coming up. And what we have seen for Memorial Day and 4th of July is that folks are traveling and relaxing maybe the infection control practices that they have been using in terms of distancing and masking. And the concern is that if we're already seeing a rise in cases and an increase in travel, in our area, a lot of that travel is, for example, to the New Jersey shore that you're seeing quite a bit of. That what might happen over the next few weeks is we have a rise in cases and then Labor Day. And if Labor Day follows the pattern that 4th of July followed, then we really are creating a little bit of a mini perfect storm for a rate of community transmission that's not at all what we would want for an ideal school reopening. And so that has led us to really recommend that the safest reopening would be to postpone an in-person reopening to early October, where really you'll have a good assessment of the true rate of community transmission in the aftermath of Labor Day, and also hopefully enough time to sort of right the ship of rising cases that we are unfortunately experiencing right now. I can talk a little bit. I just want to be mindful of how much I'm spouting off here, but why don't I just get through sort of two more pieces, and then we can open it up for questions. The caveat to that October suggestion would be that we certainly understand as pediatricians and child health researchers that there are special populations of students for whom virtual learning is really not ideal. So our youngest students and students with learning differences. And so one of the things that we are recommending is that if schools are hoping to prioritize special populations for in-person learning, that they think carefully about who those populations are, that it's a smaller group than sort of a full cohort of students, and that for a smaller group of students prioritized for in-person learning, that there may be a flexibility in having those students return before we've achieved sort of the ideal rate of community transmission. And so under sort of the parameters that we're suggesting, Montgomery County is actually very close to meeting the thresholds for which we would advise that it is safe to bring a sort of select group of students with very good and tight infection control practices at the school back for in-person instruction. The second point that I wanted to raise is that as Dr. Coffin sort of covered what we think are the key principles of infection control for in-person learning, which include distancing of at least 6 feet, masking of teachers and students, and we can talk about that if you're interested. There's usually some questions about that, and disinfection and hygiene. The other is symptom and exposure monitoring. And so just to raise that we are proposing, based on very sound evidence, that a sick policy that is informed by daily monitoring of COVID symptoms, not just temperature, but sort of a full symptom screen for both teachers and students is a very important part of infection control. And that the goal really is to keep individuals who may be sick or exposed out of school. And that's really sort of a containment strategy. And we're happy to talk through sort of what that might look like. I think it looks different depending on the school environment and the school community as to sort of whether that is done for students in the home before school or small groups of students are screened in school. You know, I think that can look a variety of different ways, but it's a very important principle to infection control, again, and one that should occur daily. So with that, why don't I pause, unless Dr. Coffin, you think I missed anything, or we can turn it over and open up for questions.
Let's open it up for questions. Meredith and I have been thinking and talking so much together and with other people about this that we have a lot of thoughts and would love to share them all with you. But this is really your time. So we're happy to answer questions that you have.
Okay, so we have Ellie Lynch. If you could unmute yourself. Ellie, do you want to speak?
Dr. Taratuski, she's using an older version of Zoom, so I'm going to promote her to a panelist, and then I'll have to remove her.
Okay, thank you. Right. Ellie, hi, thank you for joining us. Do you have some questions for our guest this evening? You're muted. Can you unmute yourself?
Sorry about that.
That's okay, thank you.
Hi, my name's Ellie. Okay. I'm a student at Springfield Township High School, and I recently joined the NAACP Youth Leadership Group. While this is my first time attending the board meeting, my group members have expressed frustration after 3 months of pushing for the infusion of African American history into our school.
Ellie, I'm gonna ask you actually to hold that until at the end of the board meeting, because right now we're having questions for Dr. Coffin and Dr. Matone. And this is not a topic, while it's very important and we certainly do want to hear about that, it's not a topic that's currently on the agenda. Okay? If you have a question for Dr. Matone or Dr. Coffin, you're welcome to certainly ask that.
Okay, I do not. Thank you.
Okay, thank you very much, Ellie. Okay. Are there any questions? Any other questions from?
Dr. Taratusky, do you mind if I ask a question on behalf of the board?
Yes, you can. And then we also have Tracy Smith. So,
Okay.
Mr. Bedard?
Tracy, I'll be quick. Dr. Coffin, Dr. Matone, thank you very much for your time. I've been spending as much time as possible trying to figure out like what infection rates really mean on a county-wide level, because the counties are so geographically dispersed. And I was wondering if you could help us put into perspective, given that the 4 collar counties around Philadelphia, collar school districts around Philadelphia County are highly concentrated in terms of population. It seems to me that the number of infections, number of deaths has been highly weighted towards our school districts. And I'm wondering if you have anything in the data that would say our rates would be higher or lower compared to the average for the county.
I'll start it and then I'll turn it over to our pro epidemiologist to comment more. I think one of the things that we're understanding is that none of the data that we collect for surveillance or for public health purposes approach the research grade that many of us are accustomed to when we're wearing other hats. And for that reason, we've really found value in using multiple metrics together to try and get multiple views on what may be happening, understanding that no single view is perfect. And what we have been using is a count of cases as a function of a standardized population size, recognizing that that is a way to do some adjustment for the population densities across different counties. Testing practices, the proportion of people who present for testing with symptoms versus asymptomatic are all biases that get introduced into these metrics of test positivity and of absolute case incidence. And the third thing that we've been recommending that people use is simply trajectory. Which direction are our cases moving in? And so with that, I'll pause and Meredith, help us out to try and understand ways to think more about urban or peri-urban and truly rural areas.
Yeah, so I think those are really important points, Susan, that, first, we don't have the data that we'd like. It is biased by who's presenting and also the massive testing shortage and testing delays, right? So we know we're on a lag because testing turnaround times are 7 to 10 days. And we also know that we're not testing everyone that we'd like to test in order to have sort of a good sense of what's going on. But I think as we think about schools, you are raising an important point that county rates may or may not be totally reflective of the school body, right? And I think that there are reasons to believe that in certain communities, and Springfield, I think in many ways may be a community that's a smaller township. When you look at the municipality data, I think that a lot of the infection rates have been driven by the large proportion of elderly individuals in this township. That said, what we have seen is that when we are at sort of a rate of community transmission that has sort of gotten to the point we're at now and is on that upward trajectory, it's really hard to insulate certain members of the community from exposure with any confidence. So I think, you know, when we think about a student body, unless we're talking about a boarding school, students and teachers are members of the broader community. And while their baseline rates may be lower than what's going on in the community, they have social exposures outside of the school. And the reason that we're so concerned right now about our elevated rates of community transmission is for exactly that reason, that the student body and the teacher community is part of that social community that is broader than just the school. And while we can try and work on establishing sort of trust in everyone's sort of use of infection control in their own personal lives, we've just seen time and again that it's very hard with confidence to insulate a certain population within a community that has rising rates from those rates.
Thank you.
Thanks. Tracy Smith?
Good evening, Dr. Hacker and board. Thanks for giving me the opportunity to talk. How are you? How is everybody? Okay?
Very good. Thanks, Tracy.
Thank you. They talked a little bit about the learning, bringing kids back with learning differences and young learners, the importance of them being in school. I'm wondering if our guest speakers could talk a little bit about our teens and the social and emotional repercussions for these kids with the depression and the isolation. We know they are very social beings, and being in school is obviously huge for academics, but it's also a very social time in their lives. So I was wondering if our speakers could talk a little bit about that, because I have seen some articles about the the impacts of the social and emotional for these teenage learners.
I can start, and then I would be interested in, if Susan has any further comments, but I think you're raising a very important point, and one that is central to why these decisions around schools are so difficult. And in many ways, I think we can all agree that there's a sort of almost a no-win here in this decision making. And that's what makes this so difficult. And I would completely agree from a child health and development perspective that the benefits of school, both educationally, socially, developmentally, for adolescents, but also all youth, are unquestionable. And I think that when Susan and I and our team make recommendations, we do so with the full weight of understanding the implications of what we are suggesting for children and their families. So we don't come to these decisions lightly. Our perspective is as child health experts and epidemiologists with a focus on safety and infection control practices. And so that is our lens, but we also think about children and families and understand and can sympathize with the hardship for all of us of time away from school. And so maybe that wasn't an answer, but I hope you understand how much we truly do sympathize and acknowledge the hard position that we're in.
And I think just to extend what Meredith said, to acknowledge that in addition to teens, families are being impacted by these recommendations. We know schools provide essential supports for broader families, food, safety, health for the child, and sometimes for their families outside of the school. So we really are highly committed to getting schools back working the way they can and do best in communities, really providing diverse essential services to children and families.
Thank you. I do get that part. I'm a public school teacher as well in a surrounding school district, and I see that we are responsible for not just teaching, but we provide 100% of our kids with breakfast and lunch at the school district where I teach. So I see that at the elementary level, but also as a parent of 2 teenagers as well. I just was kind of curious to pick your brain a little bit in terms of, that social and emotional portion in those teens as well. Thank you for your time. I appreciate it.
Thanks, Tracy. We have actually 2 more folks who have raised their hand to speak. Michael Searman and Madeline Watson. Michael, if you would like to unmute and ask your question.
Hi, yes, I would like to know a little bit more about this community transmission number that you're, if you could explain a little bit. You said that, our goal is 10 per 100,000. Is that on a daily basis or daily average or a weekly average or a 14-day average? Because, when you look at the Montgomery County website and you look at their trends that they have listed for their 14-day positivity rate, that is consistently going down. You don't see an uptick in that. That is consistently been going down since as far back as April, and it has continued to go down since July.
Sure. So thanks for raising that. So when we talk about our case incidents, we are talking over a 7-day period. So both the state and the counties are reporting 7-day rolling averages, as well as I think Montgomery County is also using 14-day metrics. And that's because some of the municipalities are a lot smaller. And so it's harder to see a trend on a 7-day basis. So the metrics that we're recommending are 7-day averages. When you look at testing positivity, so that is what proportion of individuals who are tested come back with a positive test. I believe that Montgomery County is at about 2.9%. While as a whole, the trends, you are correct, since April have declined quite a bit. We are seeing a very slight uptick in the testing positivity rate, but also that number, the testing positivity rate, is a bit confounded by the denominator of who is being tested. And we're having, particularly in Montgomery County, quite a bit of fluctuation in the number of individuals that are being tested. And so that number, the testing positivity rate, is hard in the suburbs. It's a little bit more standardized in Philadelphia, or at least sort of stable in terms of what the testing rate is. And, that small uptick that we're seeing combined with a rise of previous 7-day to current 7-day increase at the county level of number of individuals, new individuals who are positive, gives us cause for concern. And when we, again, sort of think about that data in the context of the projection work that we are doing, all of the collar counties of Philadelphia are projected to have a rise in cases over the next 3 weeks. And so while the differences might be subtle for something like a testing positivity rate, any increase, even if it's that 2.7 to 2.9%, when we combine that with sort of an overall incidence of an increase over last week of 50 additional cases this week, gives us cause for concern.
Thank you. Dr. Matone. Could we have Madeline Watson? And then there are 2 more questions that are on the 2 more folks that have their hands raised. We'll respect those questions right now, and then after Jared, after those last 2, then we will move on, if that's helpful. Thank you. Madeline? You can unmute yourself. Thanks. Go ahead. Madeline? Okay, we still can't hear you. And we can't see you either, so I'm not sure if you're still available. Rich?
Karen, maybe
Yeah.
Madeline can put her question into the chat and then we
Okay.
can respond.
That's fine. Madeline, if you can do that, put your question into the chat, and then we'll move to Joshua Williams. Mr. Williams?
Hi, is everyone able to hear me?
Yes, we are. Thank you.
All right. My name is Joshua Williams. I have more of a concern just because I have family members who still continue to go to Springfield. And I guess from the scientist's perspective, I understand that the virus tends to be more commonly asymptomatic within younger people generally. And so if we're having a situation, we're having, well, let's say October comes and we say it's clear to go, is there a really high probability with, you know, the lack of testing and the likelihood of asymptomatic people congregating, going back home and giving it to their parents, grandparents, and X, Y, and Z, and causing like either physical harm or even death in those cases? Like, how are we preparing for that reality? Or does that, I think you said 10 per every 10,000 number kind of mitigate those fears? So my real question is just the asymptomatic children meeting and then spreading it to people who are more likely to be symptomatic. How do we like weigh that outcome, I guess?
This is Susan. I'll be glad to start out. We've been thinking a lot about what are we learning over the past month when we've had a number of important research studies published, as well as reports from various school-like communities reporting out their experiences. I think what we're learning is that, unlike what we thought in early spring, children can become infected. They can actually become infected and have pretty high concentrations sometimes of virus in the respiratory secretions. And they can transmit that infection to other people, other children, and other parents. What we don't know is what about asymptomatic children. We do know that symptomatic children tend to have the high virus and the ability to transmit. What remains unclear is how much an asymptomatic child can contribute to spreading virus in a community.
Okay.
And it's very challenging and to be honest, a bit frustrating to be here with you now and say after 6 months, we don't know something that is so important to know. But because children have been kept at home in their houses, sequestered away from other kids, they have not had an opportunity to show us whether or not they have meaningful contributions to transmission of virus in the way you're describing. That doesn't offer us a lot of comfort and does cause, I think, people like Meredith and myself a lot of concern. I think the safety net is to have very low levels of virus overall in our community so that the likelihood that anyone, either symptomatic or asymptomatic, has the virus is exceptionally low. And that's where I think we see these measures of overall community burden as being really important.
All right. Thank you.
Thank you very much. Jared Epps? If you could unmute.
Hi, everybody. Can you hear me?
Yes, thanks, Jared.
Thank you. And I completely understand how hard this decision is. and all of the data that you guys are coming up with. My only concern with this whole situation, all around us, every private school is going back, or most of them are. I can't say everybody. I don't want to speak for it. They're all going back to in-school learning. And it's tough with knowing that, I don't know what it's about now, because it's about a number, or is it about the money, or I'm just so confused of what is this all really about? With my daughter, we're going to have to send her back to a daycare center, right? So, because they're still open and they're going to be doing online care there. But, it's a huge bill now that we're still going to have to pay. And with all this data that we're getting back, they're still all going. And I understand public schools is a little different. You have more people coming in. But I'm really just kind of understanding what this is all about. Is it about the money? Because understand that the teachers union, obviously you guys are still going to get paid, but private schools aren't. So they're going to bring people back. I just don't know where that number lies. I know you guys have the CDC numbers you guys set up, but it's just really confusing of really what this is all about, not going back to in-school learning.
I don't know if Meredith or I are the right people to answer that question. I think that has a lot to do with community standards and expectations for how a school district sees itself, and how the school board works with the complex community served by their district.
Fair enough. And then are they coming to you with there's this data set? Because I know who makes that data set that's what we're sticking to? Who comes up with that decision?
The recommendations that we have developed are just that, the recommendations. These aren't regulations.
Right.
And another thing to share with you is that we have, over the course of our experience watching this virus, studying it, talking with various community settings, evolved what our recommendations are to incorporate the new things that we're learning. And so I think it is likely that these numbers will change again in the next 3 to 4 to 5 months. And it's hard for me to share that with a community that's struggling to get a handle on when can I expect X, Y, or Z, so I can get my work life, my family life, my everything else back on track. This virus hasn't allowed us to plan.
Yeah, and I completely understand that. I completely. And the other concern, obviously, is that not that it's really respectful, but a lot of these kids are going to go back to grandparents, if they can't be done, and that's just the realness of the situation, and that's going back to the worst population. I understand this. It's got to be the toughest decision in the world. I understand. I just throwing it all out there.
Yeah. This is such a personal decision on every level, whether it's at the level of the individual community, the individual school, and especially on the individual family. And I don't think they're easy rules. What we try to do is share some of our perspectives, so you may have more information to take back to your dinner table to talk through with the people that are most important to you about how to make the best decision given where we are now.
Yeah, no, I appreciate that.
Thank you, Jared. I see that Madeline is back on. We'll give her one more opportunity to, hopefully we can work out the technology for that. And then we're going to need to bring this portion of our meeting to a close so that we can move on to the public comments on the agenda. So I see there are some other folks with hands raised, and I'm hoping that they'll be able to stay on for the public comment period. Madeline?
Hi, can you hear me now?
Yes, thank you.
All right, sorry about that.
That's okay.
Alongside of some previous asked questions, you spoke about taking everything into consideration with the kids' mental health and the risk of going back to school. And I just wonder, usually it's the sick who are isolated and the healthy that are not. And I just, if that's weighed in, I don't see how the risk versus reward, or what are the odds of people that they're going to bring home COVID versus the odds that they are going to be severely affected with their emotional intelligence, social isolation, and all of these other things to their mental health that could be long-term. I think that that's a worse risk to take than just have them in school.
Okay, thanks, Madeline. Did you have a question for one of
Yes,
for the physicians?
If you're, do you take those, you said you take those into consideration, but I mean, the guidelines for opening school, the recommendations by the CDC all say that the numbers are very low. It's up to the school district. You guys can let the kids go back or you cannot. You spoke about having confidence in the schools. I mean, apparently the school was prepared to open. So I don't understand why the mental health is being put in the background, in the back burner. Why? Why is that not considered?
So, I don't know if Dr. Matone or Dr. Coffin, if you have any comments on, I know that you did, Dr. Matone.
I can just share with you what the limitations are, Madeline, and I want to be very clear. We're not happy about this. We do not think that our recommendations can fully encompass all of the positive and risky consequences of any decision one makes under these circumstances. And I think we got a good flavor of that from the last questioner who brought up questions about grandparents with the responsibility of caring for young children. And so our expertise is from the health and the health perspective, and we do not have enough knowledge about any individual community or family's circumstances to be able to tailor these recommendations to make them work best for everyone. And I feel sad, to be quite honest, that we don't have something better and more satisfying to share with all of you. We offer these comments as part of the decision making your school district needs to go through, but not as the ultimate guide, but just part of it.
Okay, thank you. Thanks, Madeline. We appreciate your comment. Did you have another question for Dr. Coffin or Dr. Matone?
I mean, yeah, just one more thing. Why isn't there a specialist here for that? If 100% of the kids are going to be affected, their mental state, their emotional state, and all of these other things, why isn't there a psychologist on here to speak on that? And you said you were sad about that. Well, I'm sad that nobody cares about the mental health of the children, because that's 100% of the kids are going to face that.
Madeline?
What percentage of the kids are going to get sick?
Madeline, Madeline, thank you very much for your comment. I did want to share that personally, I am a psychologist. I'm a clinical psychologist. I'm also a school psychologist, and I work in another district. And so as we speak later on our thoughts on the agenda item, I'm happy to share some of my thoughts in relation to mental health of students. At this point, I think we need to bring this comment period to a close so that we can move forward with the public comments on agenda items. And I really want to thank Dr. Matone and Dr. Coffin for the time that they've spent with us this evening, the information that they've shared, and we greatly respect the work and the time that you have put into thinking about our children and this pandemic crisis.
Thank you.
For having us. Best of luck.
Sure.
Thank you.
Thank you so much to both of you. And thank you for responding to the invitation, for being here this evening. As you mentioned, we know you've been making the rounds along with Dr. David Rubin from CHOP, going to many of these school district board meetings. So thank you for putting in these additional hours every evening in order to be able to address questions from community members, students, board members and staff members. We greatly appreciate it. And Meredith, we're just very lucky to have you here as a resident of our township as well. So thank you both.
Thanks very much.
Bye-bye.
Thanks very much. Bye-bye.
And Dr. Tusky, I did want to say I was monitoring the chat for any open questions.
Okay.
I think most were covered. I think we can capture some as comments and just make sure that Mr. Oliver captures these for our records.
Okay, great. Thank you very much.
Yep.
All right. There is now time in our agenda for public comments pertaining to the agenda items that are on tonight's meeting agenda. So I just would encourage those of you who wish to speak directly to those items. Again, as I mentioned before, we really want to try to allow anyone who wants to speak to be heard. If there are factual questions that we can answer, we will be happy to do so. And we'll try to do that to the best of our ability. We'd like to try to keep any comments to at least about a 3-minute time period so that we can allow folks to come in and speak. When you are called on, I would like you to please try to state your name and your address within the township. Okay. So Amy Thalner is our first comment. Amy, you can unmute yourself.
Hi, good evening. I was just typing into the chat box in case I couldn't be heard. I do think that Madeline's question regarding isolation and student mental health does deserve to be heard and maybe addressed later on in the agenda. I suppose my question is related to isolation. I would like to hear more about plans to bring somehow the students together, maybe in small groups, to meet, to socialize, maybe to use the facilities, the playing fields, the playgrounds, in order to fulfill physical education and health curriculum requirements, something to bring them together and to address this protracted isolation that seems to be happening.
So Amy, thank you for asking that question. I believe I can address that. We actually have an administrative meeting tomorrow with all of the administrators in the entire district, and that's actually one of the topics on our agenda. I know that at least one and probably 2 or 3 of our building principals are looking at ways to do that as we speak. I was over at one of the schools today and had a lengthy conversation with one of the building principals. What has been expressed to me is that the teachers in that particular school are actually very anxious to have children come in and meet one another. It's a little bit easier to do something like that on a staggered schedule, where you only have 1 or potentially 2 classes coming in at a time. They can go into a large group space like the auditorium or the cafeteria. A teacher can stand up on the stage, and we can ensure that there's really excellent social distancing of what the doctors have recommended. And when we do it for a limited time like that, we also don't have to worry about hundreds of children being in the hallways at the same time, moving in and out of classrooms. So I can tell you that we too are very concerned about student mental health. Just because the recommendation has been to go virtual doesn't mean that we are ignoring the fact that we know that students suffer when they're home and they can't be with their friends. They're social creatures. So we are trying to find ways to bring students in to see if they can at least have some semblance of opportunities to be together. And each building principal is going to be looking at that. It's also dependent on staffing as well, and having our staff members coming in and trying to do this in a way in which parents would feel comfortable and staff members would feel comfortable as well. So we are going to be talking about that.
Great. I'm glad it's being thought of. Maybe there would be a way to make it voluntary, not a curriculum or a class requirement. Something for students who are willing to take the risk to do it with maybe some sort of regularity.
Yeah, we certainly, and that's a wonderful point. Thank you for mentioning that. This is the type of thing where we would not require it, because we know that particularly if we built a staggered schedule where students came in over the course of a day in different classes, transportation might be an issue for different children, getting to school, getting home. So we certainly wouldn't require it, but would offer it out as an opportunity for them. So thank you for that.
Okay, great. Thank you.
Thanks, Amy. Keisha Bronson.
Hi, so I had a question. Thank you for your time. Thank you for your consideration. The one comment that I make, just first of all, on behalf of myself, and I know many parents, there's no right or wrong answer. So as much as you're hearing emotional challenges and frustrations, I think I just want to say thank you for all the consideration, because there is no right or wrong answer, and every child and every family and every situation is different. One thing I do continue to hear is that this recommendation is for school opening. So I'd like to understand that. I guess I didn't quite get it in as the questions, but like, what's the frequency of evaluating this decision, right? So we're saying it's for school opening. I think I heard a comment around the logic behind Labor Day and potentially the next flood being around October. So are we saying this is going to be term 1 and then we'll have another phase of reevaluation for term 2? Are we saying this is going to be the lean in for the entire year, but maybe we consider it after Christmas? Like, what is our frequency, just so we can maybe potentially wrap our mind around knowing it's fluid, knowing it's not determined, it's not definitive. How constant are you guys going to be evaluating this and looking to make a potential recommendation for an adjustment back to hybrid or back to in-person, if at all, for the 2021 school year?
So Keisha, I can address that by saying, unfortunately, I don't know how to answer the question other than to say we don't have a crystal ball. This is a new situation for all of us. We don't know what the factors are going to be as we move over the next several weeks or even months, which could potentially influence our decision. As someone correctly said, we started out the summer by sincerely hoping and planning for bringing children back into school, and we've had to reverse course on that. So I think time will tell. As you heard the doctor say, the incidences appear to be trending upward, and we believe we know that after Labor Day, because of a holiday weekend, we may see higher incidences as positivity rates increase after closer contact over the weekend and events over that weekend. So we have to wait and see when that downslide begins to occur and how long it takes. And we will continue to evaluate through the month of October. Right now, what we have basically done is to determine that our intent is to go virtual through the end of the first marking period, because that's a natural break in the year. But if things were successful enough that we felt that not only incidence rates were low, but we felt that because of the change in the weather, with less people going outdoors and gathering outdoors, as is typical in the summer, and we felt that there was a large commitment and partnership with our students and staff and families in order to try to intend to open under safer conditions, then we might reevaluate that earlier than the first week in November. But right now, that's the timeline that we've set, because again, that's a natural break for us, and it would be easy to evaluate on a quarterly basis.
Thank you, I appreciate that. And again, thank you.
Gabrielle Green.
Hi, I appreciate all you guys are doing to make sure that we go back in a safe and appropriate time. I just wanted to talk from a student standpoint, just more of an ethical standpoint of making sure to teach our kids and our other peers the lesson of making sure that we take into consideration other people more than ourselves. This pandemic doesn't just affect us, but it affects everyone around us. So I just wanted to make sure that, you know, as we go back and everything, that we make sure that we're keeping other people in mind and other people in consideration when we talk about, you know, mental health and everything, that we also bring up the fact that, you know, we have to be safe physically in order to really think about that type of stuff. And that other people have compromised immune systems, other health issues going on, that if we try and push to go back too early, that will be compromised and affected. So I just want to thank you guys for making sure that we go back at a safe and appropriate time.
Thanks, Gabrielle. Erin Finnegan.
Hello, this is Erin.
Hi, Erin.
Hi, I live at 8815 Wainwright Road in Winmore.
Thanks.
I am disappointed with the decision, but trying to make plans for what this will look like for myself and my family in the fall. And I just wanted to point out, this is less of a question, just more of a keep in mind when decisions are being made. Making it easier for the parents, especially in a two-parent working household. The schedules came out today for Erdenheim and Enfield. And if you look at them, the lunch periods are at different times. So Enfield's start at 10 and Erdenheim's starts at 11 and Erdenheim's is 11:30. I may have those mixed up, but just to say, I have one student in each grade in each school. So now I'm trying to manage two different lunch periods. So that would be helpful if we could align among the schools on similar timelines. And then also what I really felt like in the spring, there was a true lack of resources for parents. I couldn't get a hold of the teacher. I couldn't get a hold of the answer booklet for the math, which was difficult when I didn't understand some of the questions, what they were trying to get the students to say. So I think having resources for the parents would be very helpful, and also advanced resource notification. So for my second grader in math, she was doing measurements in centimeters, and I didn't have a centimeter ruler, but I could have gotten one in time if I was notified the week before. Hey guys, we're learning about centimeters next week. Make sure you have a ruler in your house that does centimeters. So that was just kind of pain points that I felt in the spring that I'd like to kind of resolve for the fall, just to make it easier for everyone.
Thanks, Erin. You brought up some really good points, and I took some notes on those that I can share when we have our administrative meeting tomorrow. I think most of the administrators are probably listening in this evening, so they probably heard exactly what you brought up as well. So thank you.
Thanks.
Thanks, Erin. Nancy Minero. You can unmute, Nancy.
Hi, this is Anthony Minero.
Oh, hi, Anthony. How are you?
Good, good. Thank you all.
Sure.
I just have a question. What are the plans for children with special needs? Those with profound disabilities, children that cannot attend to any virtual learning. We have two. Are the staff to those children considered essential? And because we've had no services since March 12th, because our boys cannot attend to virtual learning, we have no other options. So what are we planning for those types of children?
So Tony, I think I can answer your question. I know you've been in contact several times with Dr. Johnston.
Yes.
And I know she is working with your family very closely.
Yes.
You know, we obviously don't want to comment on individual children here in this particular forum, but what I can share is that every special education child's needs are different, and we are trying to manage those as we would under any other situation in terms of determining what particular supports and needs each child is going to be in need of for the fall, and then working with families. I know one thing that Dr. Johnston has repeatedly said is very important, particularly for a number of special needs students, is assessing and determining where they are in terms of their learning for a period of 2 to 3 weeks at the start of the school year so that we can establish some benchmarks in order to be able to tighten up the specific goals that are being put in the IEP so that we have measurable progress monitoring that we can do once we know where students are when they come back to us in the fall. So again, I know that she's been working closely with your family and she's working on solutions for both you and your wife and your children.
Okay. Thank you.
Thanks, Tony. Bethany Knoll. You can unmute, Bethany.
Hi, how are you?
Good, how are you?
So I'm in Orland, and I have an incoming first grader, and question about attendance requirements and if we're going to be penalized if we don't check in at the exact time every morning if we have 2 working parents. How is that going to work to have a 6-year-old in front of a screen for a proposed 6 hours?
So I can answer that on a general basis, Bethany. I would recommend that maybe you have a more detailed conversation with Dr. Van Voren, who is your child's principal. But attendance is important, and we will be monitoring attendance. I think there is flexibility, however, in terms of the time for check-in. We want to obviously make sure that children are trying to keep up as best they can. So there's going to have to be flexibility for parental situations such as the one that you've described where parents are working. So the best suggestion is to check in now in order to try to get a response to your specific question with Dr. Van Voren. But then, of course, when the school year starts, I would also recommend that you check in with your child's teacher and say, is there another point during the day when you'll be able to at least affirm that my child was paying attention and was in class for the day? I think there are ways that we can certainly manage that to help you out.
So you're saying we should just be in contact mostly with the teacher that is the head of the class?
I'm sorry, I didn't hear you.
So we need to be more in contact with our direct teacher then, as
What
far
I'm
as an
saying
over.
is, what I'm saying is you have the opportunity now to speak with the principal about the specific concerns that you have over attendance, but it is always best to simply check with the teacher and say, I don't know whether or not I'm going to be able to check in at the same time every day with my child. What other arrangements can we make so that attendance will be counted or that it won't be held against him or her?
Great, thank you.
You're welcome.
Thanks, Bethany. Matt Cohen?
Oh, hi, good evening. Can you hear me?
Yes, we can. Thanks, Matt.
Oh, excellent. Thank you. Thank you. I appreciate being part of the meeting. I wanted to just make a general comment to kind of implore the board to take into account the weight of the decision, because I feel like each school district kind of has the weight of the whole community on it, and then you look at it as our fellow neighbor just mentioned, the parents in the working situation. It seems like society can't function properly if one thing doesn't occur first. It's like a vicious cycle. I was even talking to my wife about the teachers. A lot of the teachers of Enfield specifically, if they have younger children and their child is not in our district, how would they care for their children when they're supposed to show up to Enfield? So there's a lot of dilemmas. So I just wanted to make that comment. And then the only other comment I had was, you have stores, you have supermarkets, you have all types of public entities that people seem to make it work to deal with public and strangers. I look at our school as a safe environment, protocols, best practices, great minds like Dr. Hacker, the board, the teachers, and I feel like it's a very small subset that can't be compared to the public with the county statistics that were mentioned earlier, because that's people walking out and about in the public doing as they please. But if you, Dr. Hacker, make rules and the staff and the parents and the students follow them, I don't think we're necessarily subjected to all of those potential negative outcomes. And, you almost can make a contract with each family as far as what they're committing to do. And so I'm just curious to see the decision. We're eager, and based on how they decide, we may consider sending our child to a private school for second grade. She's entering second grade. We don't like the idea of her sitting in front of a computer all day, not really knowing how it will play out. But we're hopeful still that there'll be a plan to either ease them in very soon or to start them September 4th as planned. And I appreciate you hearing my thoughts.
Thanks, Matt.
Thank you.
I just want to, we have Marty Rogoff up next. And I would like to just remind folks as they're speaking to please just share with us your address within the township. Thanks. Marty?
Yeah, can you hear me?
We can.
Okay, so first of all, thank you for allowing me to speak. And I would just like to make some comments about something that no one is speaking about. And I really respect and understand all of the parents' concerns, whether it's the education, whether it's going back to work, whether it's the socialization. I have a daughter who's a single parent. I feel what you're feeling. There's an elephant in the room that nobody is discussing, and I would like to discuss that, please. I drive bus number 61 for Springfield Township. And I will tell you, I love my kids. They're great. When they're on my bus, they're not your kids anymore. They're my kids, just like I treat my grandchildren. Their safety is number one, whether it's on the road or whether it's this virus. We can possibly social distance within a classroom. Classroom is 20 by 20 by 10 approximately. You can't social distance on a bus. I have 19 little ones on a 24-seat bus. In the best of times, it's a petri dish. A child sneezes, coughs, wipes their nose, whatever they're doing. And you can, I've been sick numerous times because of it. You just pass this stuff along. It's what happens. And even if you try to limit the number of children on a bus, we don't have enough buses. And we certainly don't have enough bus drivers. Our school district parents is terrific. We work for the municipality. We work for you. We're not a private bus company that has to turn a profit. Our buses are sanitized in the mornings. They're sanitized in the afternoons. That's great. Kids will probably wear masks, but they're kids. They're going to move their mask. They're going to cough. They're going to sneeze. They're going to wipe a runny nose. They're going to touch the seats. They're going to bring things on that are not sanitized.
Excuse me, Marty?
Yes.
You have 30 seconds remaining.
The 30 seconds is school bus is a petri dish. Your drivers, most of whom are 60 years or older, very susceptible to this virus. Would you bring 19 kids into your living room? My school bus is smaller than your living room. Please consider that. Thank you.
Thank you, Marty. We appreciate your time and we appreciate your service to the district. Susan Daly. Susan, you can unmute. There you go.
I'm actually Grace Daly. I'm on my mom's account.
Hi, Grace.
Hi. I'm an incoming freshman. I live on 307 Penn Oak Road in Flowertown. And personally, for me and my siblings, as well as some of my friends, I found it very hard last spring to learn out of a classroom setting. So my question to you is, what training, if any, are the teachers receiving in order to help us ensure children understand concepts they're learning as if they were in a classroom setting?
Susan, that is a terrific question. Or Grace, sorry.
It's
I
Grace.
said Susan 'cause I'm looking, it's Grace. That is really a terrific question, and thank you for asking that, because many other parents have asked that in emails that I've received. And the teachers have been working extraordinarily hard since the shutdown last spring. Don't forget that when we shut down last spring, it was impromptu. Literally, we got the news that we were being mandated to do so, and an hour later, we closed schools. So there was no opportunity at that point to train staff or to really align what staff members were doing, even though they tried hard to do that with departmental and team meetings. So since that time, the principals have been working in close conjunction with their leadership teams all throughout the summer. A number of teachers have been investing a significant amount of time. We've also explored resources from the Montgomery County Intermediate Unit. In fact, I believe there either was at the last board meeting or tonight. I'm getting confused with all the motions, so you'll have to excuse me. We approved learning modules that the teachers have to do regarding virtual learning. They are on classroom management in a virtual environment, instructional design and delivery, and assessment. And that includes keeping students engaged so that students like you won't be bored and won't be tired of logging into a computer. So we've made sure through the additional training that we've done with our staff, as well as redesigning the schedules, that there is going to be more live instruction going on at every single grade level with every single teacher, as well as actual coursework that teachers are taking in order to improve their skills. So we've provided them with numerous resources, and I really thank you for asking that terrific question.
Thank you.
Thanks, Grace. Okay, Tracy Smith.
Thanks again for having me back. I am actually commenting on the field remediation on the agenda. I see that there is an $18,000 motion for the turf fields. Is that due to just wear and tear, or were there issues that needed to be corrected? And secondly, since we're talking about the fields, are we talking about opening these fields back up to the community? I know that at this point, you know, captain's practices and voluntary workouts and things like that have been suspended, that have been school organized. But how about the community getting back on, being able to use the track to walk and those types of things as well? Thank you.
So Tracy, I'm going to let Mr. King address the issue. I know there were some issues as a result of the last storm that we had, but I'm going to ask Mr. King to address the specific motion that's on the agenda. And obviously with all sports shut down through Suburban 1, we have not made a determination at this point in terms of opening up the fields. We're also very conscious, obviously, of trying to not only appease the community with giving them places to walk and so forth, but we shut them down previously because unfortunately what we were finding was when there was community use of the fields, people were going onto the school property without masks and without social distancing. So we took that as a preemptive measure in order to try to protect members of the community. We have to be assured, and you've heard this said several times this evening, that everyone makes a commitment to do the right thing. And we bear a responsibility when people are coming onto our district fields to ensure that their behaviors are safe. And that was not happening. We were having unplanned practices from sports teams from other private schools that were coming onto our fields. They were not social distancing or practicing good preventive disease measures, and so that was why we shut them back down again. So before we open them up to the community, we want to make sure they're going to be used appropriately by the individuals who come onto them. So
But
Ken,
Dr. Hector, but quickly, the tennis courts are open though, and people are using those.
Yes, but you have 2 people at a time or 4 people at a time on a tennis court, as opposed to groups of people who are either walking on the track or having football practice. So that was the distinguishing factor. Ken, can you address the turf field, please?
Yes, you are correct. With the hurricane that came 2-3 weeks ago, I guess. Both turf fields experienced a lot of damage from a tremendous amount of rain in a short period of time. That amount of rainwater lifted the carpets and stretched and wrinkled the turf field itself in both fields, requiring us to seek remediation for those fields so that when sports does return, those fields are usable for the sports that they were intended for.
Thank you. I would like I would like to see those fields, those tracks and things, open back up, as soon as we can, and trying to maybe get a commitment from people to abide by those rules as well. Thank you.
Thanks, Tracy.
Thank you, Tracy. Allison Harris.
Hi, I'm Allison Harris. I'm on Weiss Avenue in Flowertown. Thank you all for taking my question and comment here. I wanted to say that, I appreciate that it sounds like there's an increase in live and synchronous content, which, as I understand, was one of the, is in response to some of the community and parent feedback. But, I'm thinking again back to working parents. And I think as you said, and sorry to paraphrase, but, we were all kind of trying to get through it last semester. I think we're all hoping for better now, but so are our employers. They're hoping for a more sustained strategy that gets back to productivity. And so when I hear like the earlier commenter asked about attendance and morning logins, to me, it sounds like that's not something that should be placed on the individual family to have those conversations. It seems to me like there might be more systematic options to take into account the concerns of working parents. I think that there are going to be disadvantages for families who have 2 working parents, and you can consider different populations who might be more affected than others. I think there needs to be some consideration up front for that rather than leaving it on the individual family to make an arrangement. One of the thoughts I had was as to whether or not a fully asynchronous option could be a possibility. As a parent of a kindergartner and also an educator, I know that the attention span is something in the range of 8 to 9 minutes. So my concerns are both as a working parent to try to fit in all the live and synchronous content, as well as from a developmental perspective, my child's ability to maintain attention through live Zoom. So I'm asking if there is an asynchronous content option. And if not, what do you say to parents who are then considering homeschooling, who previously had never considered that and moved here for the school district? So I hope that was clear. I'll give you a chance to answer.
Yeah, we do not have an asynchronous option at this point. In fact, by and large, the number one concern that we did hear from parents over the course of the spring was that they wanted more live instruction so that children could be engaged while they were online. And we've worked very hard to include that in terms of the schedules that have been developed. And again, I would go back to the recommendation that I made before. We're being held accountable by the Pennsylvania Department of Education, and that's part of what the resolution for this evening says in terms of student attendance. So for parents who have concerns about that and how that's going to be counted, it is important to reach out to the classroom teacher or to the principal in order to discuss how that can be monitored and how your child can be counted in. As far as homeschooling is concerned, we understand that parents have concerns if they're working parents. They always have the option to do that, although that kind of runs counter to if you're homeschooling children, then you need somebody in the home to be able to homeschool them. So unless you're willing to bring somebody else in to do that, that becomes a challenge as well. But we're certainly willing to work with families on that.
Thank you. I think it comes down to the flexibility and the need to be present at our own jobs perhaps in conflict with some of those mandatory check-in sessions.
Mhm. Understood, Allison. Thank you. Jared Hay.
Hi, good evening. Can you hear me okay?
Yes, Jared. Could you share your address, your location, please?
Lorraine Avenue in Orland. Thank you for your time. My comment is not about the overall decision. I certainly respect and understand that this is not an easy decision, but I think we're all resigned to the fact that starting virtual is probably the only alternative at this point. My question or comment is about the daily schedules that came out today, or at least the sample schedules. I don't know if these are still going to be discussed further in the particular schools. I have a student who's going into 5th grade and going into 8th grade. I have some questions about what came out today, in no particular order. I don't understand why
Mr. Hay,
these schools.
excuse me. Let me interrupt you just to simply say that none of us is totally familiar with every single building schedule. I certainly have looked at them, but I think if you have specific questions for each of your children, especially because they're in 2 different buildings, your best bet is to really contact the building principal who devised that schedule in conjunction with their learning or their leadership council from their school, so they can best answer those specific questions for you.
Okay, I appreciate that, Dr. Herron, thank you. But I think this is a fair question to ask the board. Why is the elementary school starting at 9:05 instead of the normal day that school has always started at? I don't, to date, no one has suggested or even hinted that the school day is going to now be shorter. My concern is that what assurances are there going to be in the elementary school between teacher and teacher as to how much live instruction is going to be given? I see here that it says a minimum of 20 minutes is going to be given per class, but what, is if one teacher is going to be 20 minutes and that's it versus another teacher is going to be longer, what assurances do the parents of the Erdenheim kids do we have to make sure that they're getting as much live instruction as I think that they should be? Another question that I had is, why is the Wednesdays in the middle school essentially going to be not an on-off day? It seems like there's not going to be, other than taking attendance, it's going to be all assignments just given out, and there's not going to be any live instruction. My question is...
Excuse me, Mr. Hay?
Yes.
You have less than 30 seconds remaining.
Okay, I appreciate that. I just want, I like to know generally, the schedule says that day is going to be available for, kids who need additional instruction. Once that additional instruction might be given out, what else is the teacher going to be doing that day for the particular kids? So thank you.
So again, Mr. Hay, I would really recommend that you reach out to both Mr. Fuller and to Dr. McLaurin at Erdenheim in order to get answers to those questions about the schedules.
Thank you, Mr. Hay. Stephanie Fliegelman?
Yes, hi. Thank you for taking my hand. I live at 8 Rich Ave in Erdenheim.
Mm-hmm.
So first of all, I wanted to piggyback on the teacher training. I appreciate knowing that they have been working on training and are trying to increase their skills to prepare for the fall. I have 2 questions. One is, I have a kindergarten and a second grader, and I want a better understanding of what it will look like, what the insight of the schedule is going to be. For example, they start off the day with 30 minutes of a meeting. Then that follows 30-minute direct instruction by teacher, followed by 40 minutes of a cooperative learning for a subject, followed by 30 minutes of independent work. I understand the independent work, but what is a cooperative learning? Sorry, that's my daughter just woke up. What is cooperative learning going to look like on virtual learning, and what is the teacher teaching for 30 minutes? Like what are they doing during that time period? Because that's like an hour and a half for a kindergartner and a second grader to be looking, at the screen, for instance.
So again, I think specific questions regarding the schedule really should be directed to the building principal. But in general, I can answer some of your questions. The morning meeting is a typical way in most elementary school classrooms that the teachers begin the day. It's a community building opportunity for the class to come together and to start the day together without specific instruction in math or language arts or another subject area. So children have the opportunity to talk about what they did at home, a special event coming up in their lives, a visit with a grandparent and so forth, as well as going over the calendar and what the weather is and so forth. So it's a coming together of the class before actual instruction begins. In terms of the cooperative work, through the various technological resources that the teachers have available to them, they can actually put students in groups so that children can pair up or work in little triads, and they can work on activities together, which gives them an opportunity, even virtually, for them to be able to work in small groups as they would do as if they're in a regular classroom. So again, in terms of those specific activities and what it will look like, it's really best to discuss that with the principal or the teacher, but those opportunities have been built into the schedule. And what it also does, it gives children transition opportunities so that they're not just in front of the teacher as a class for the entire period of time. They have an opportunity to work with other children in what's similar to a breakout room. They have an opportunity to work independently and then come back together as a class as well. So there are a lot of different kinds of transitions as well as different types of learning activities built in, because the teachers are very well aware that for smaller children, they don't have the same attention spans that older children have. So all of that has been planned very specifically and mindfully around the developmental ages and attention spans of those children.
Okay, that makes sense. And the time frame of the day, that's a Pennsylvania state requirement that you guys have to meet, the requirements for that? Or is there flexibility now that it's virtual?
Yeah, so the number of hours that are required at the elementary school level, or the number of days, which is included in the resolution that the board members will be voting on this evening, is set by the state. That's in school code, and we are required to offer at the elementary level 900 hours of instruction, 180 school days. As far as the length of each school day, that's set by us in the school district, and it's based on the contractual time of our teachers.
Okay. And then one more note, just because I know that you said that you have an administrative meeting tomorrow. For specials, if we have children in different grades, is there a way to align the specials? For instance, can my kindergartner participate in the special of a second grade classroom if it's not live? Can they do the same activities and submit it and get credit for it? Or do I have to set up 2 separate gym sessions at the same time, like at the same day, just at different times?
Again, I think that's a better question to ask your building principal. Yeah, I'm sorry that I can't specifically address that. But what I would say is they would be operating under a different curriculum. Don't forget the specials also, whether it's art, music, physical education, they have specific things in their daily curriculum that they are covering in terms of course content. So I think it would be challenging. Phys ed, of course, might be a little bit different, but you'd have to discuss that with the principal.
Thank you.
You're welcome.
If I could just jump in, there was a comment in the chat, which I believe, Dr. Hacker, if you could address this. It's asking if each school principal would consider doing a Zoom call or forum similar to this to answer those specific questions for the schools. And my understanding is there is a plan for back to school conversations for parents and students, if you could address that.
Are you asking about the back to school nights?
Yes.
Back to school night is really more of an opportunity for parents to speak with the individual teacher than it is to really talk with the building leaders. Generally for back to school night, and I know the principals are trying to work on a virtual back to school night option as we speak. They're planning those opportunities as well as other events for the start of the school year in September. Generally though, the principal provides an overview, but really turns the rest of the evening over to the individual teachers so that the parents have an opportunity to hear from the teacher what is going to be taking place over the course of the year, what the curriculum content is, what their normal day looks like, and so forth. And there really is not a significant amount of opportunity for questions on a typical back to school night type program. So I can certainly raise with the building principals whether or not they'd be willing to have, for example, grade level focus group meetings with parents, if that's really what the question is.
Yeah, actually, go ahead. Sorry, Jeff.
That's how I interpret it, was that if we could pass that along to the principals as a consideration, I think that would be a sufficient.
And I think there are actually several comments in the chat about that being helpful to teachers, to parents, to have a meeting with administrators for these building specific questions before school starts, so that parents can have their expectations set.
I will take a minute to plug the PTA for the middle school and high school. I had a great meeting last week where the school administrators were there addressing questions. So continued involvement there makes a lot of sense.
Great. Kate Widmeyer, I'm sorry about pronouncing your name.
It's Widmeyer. Thank you very much for your time, everybody.
Sure.
My name is Katie, and I am a new resident to the township as well as to the school district. I live on Orland Avenue, and I would just like to thank everybody for their time in putting this all together. I know you have been facing enormous challenges since March, and challenges that none of us have ever foreseen coming. I just want to thank you all so much for working diligently with this. All of my questions have actually been answered, so I appreciate your time, and I look forward to working with you as my children come up through the school district. Thank you very much.
Thank you, Katie. Thank you. Marcy Landsman. Marcy is not in. Nick Singer.
Yes, hello?
Hi, Nick.
Hi, that was a lot quicker than I thought.
Okay. Please share with us where you live in the township, please.
Oh, sorry, yeah, 709 Preston Road.
Thank you.
So my question is, and it may have been addressed, we came late to the meeting. Is this decision, is this going to be for the entire school district, or are we going to have concerns with the younger kids that need more structured learning?
This recommendation is for the entire school district, and I believe all the building schedules were sent out today. So
Right.
in terms of looking at the structure, you can consult the specific schedule and then make a decision as to whether or not you have more specific questions you'd like to direct to the building principal.
Okay. Yeah, all right, that's it then, thanks.
Okay, thanks, Nick. Alyssa Searman.
Hi, it's Elisa Searman. I live on Devine Drive in Winmore.
Hi, Lisa.
And my question has to do with technology and contingency plans, because we know technology is not always reliable, and our kids are going to be on our home wireless networks. The teachers are going to be on wireless. So what happens if a kid is kicked out and can't get back in, or if there's a power outage? And we know in Springfield, sometimes it takes a couple days to get back on. So will will classes be recorded? So if they happen, but a particular student can't get in, they have an opportunity to see what they missed. And on the flip side, what happens if it's the teacher who loses their power and all the kids are trying to get in and there's nowhere to go to because there's no teacher there?
So we have a significant amount of tech support that's available through our technology department, but as you stated, Elisa, we know that glitches do happen, and obviously we all have to be flexible in terms of those events that potentially can happen. And that's messaging, obviously, that has to get out to the staff that they need to understand and be flexible when students cannot get in. We generally do not record. That is a contractual issue with staff members. So in lieu of recording, if any student cannot get in for any particular reason, then that again should be messaging that's sent later on, some type of communication as soon as up and running with email, telephone to the principal or whatever, so that we can be made aware of that and we can make adjustments for that. There is certainly flexibility involved when we know that there's a technology glitch and through no fault of their own, the student cannot participate. Similarly with the teacher, obviously those glitches happen. That's just unfortunately something that, you know, we're going to try to deal with either through an alternate means. So for example, sometimes the teacher can't necessarily participate via Zoom, but they can call in via their telephone. So we're going to have to work on what those alternate measures are and make sure our teachers are familiar with what they are as well.
Great, thank you. And hopefully that would also be communicated to the parents so that we also know what to do in those instances if our internet goes out.
Yep, thank you. That's a great point.
Sure, thank you.
Thanks, Alyssa. Paris Thompson.
Hi, can you all hear me?
Yes, we can, thanks.
I was just wondering if I could speak on agenda topic number 7.
Sure.
Okay, so my name is Paris Thompson. I'm a rising senior at the high school and also a member of the NAACP Youth Leadership Committee. Recently, we were granted access to curriculum changes for this school year and are in the process of offering suggestions to infuse multicultural history into it. Similarly, I'd like to request access to the bias training materials for teachers so our group can review them as well. So yeah, that was just my request for access to those documents.
So Paris, those documents belong to our trainer, Dr. Crystal Lucky, who is an associate professor of African American Studies and English at Villanova University. And so it would be really up to her to determine whether or not she would be willing to share those with students. And we can certainly make that request of her, but because they are her materials, we really don't have the option to be able to tell you at this time whether or not she'd be willing to do that.
Okay, thank you. Could I
You're
get her
welcome.
contact information from you by any chance?
Here's my recommendation. I do have it, but I don't have it at the moment. You should be able to Google her at Villanova.
Okay.
That's what I would recommend if you want to look her up right now. Otherwise, if you send me an email tomorrow, Paris, I can send it to you.
Okay, thank you so much.
You're welcome.
Thanks, Paris. Robert Lally.
Hi, can you hear me?
Yes, we can, thanks. Could you share your address within the township, please?
Yes, hi, I live in Preston Road in Flowertown.
Okay.
Yeah, so all these questions have been very informative, but mine's more about process and being proactive. So can we talk about what we're doing, I guess, to actively meet the guidelines to open as soon as possible, just in case, if and when that time comes, we're ready to go? I haven't really heard anybody talk about that.
Well, Mr. Lally, I guess the best way for me to answer it, as you probably are aware, we had been planning to open, so we certainly had a plan in place for how we would do that. We would have to make minor revisions to that plan. One of the limitations of the plan for opening, which was partially the reason why we decided we had to go virtual, is because given the numbers of students that we felt like we had a pretty good handle on that were returning to school in the fall, we would not be able to socially distance at the recommended 6 feet in many of our classrooms. And that was part of the reason, not the entire reason, why we decided we had to go virtual, simply because we could not achieve that social distancing, which was so important either on our school buses, as you heard this evening, or in many of our classrooms, particularly at the elementary level. So we would have to reevaluate aspects of the plan that we had in place, but because we did have a plan in place, we would not have to start from ground zero. We could more or less pick up where we left off, hopefully make some good tweaks. But some of those tweaks, again, because of the social distancing concerns at the elementary level, might have to include, instead of a 5-day-a-week initial opening, a hybrid opening where kids only came in 2 days a week instead of 5 days a week. So that's something we would have to reevaluate before we made any decision to reopen.
Okay, thank you.
Thank you, Mr. Lally. Barbara Johnston.
She's going to come in as a panelist.
Okay. Hi, Barbara.
Hi. I'm a driver. I'm sure there's a few drivers that's on. Can you explain what's on your agenda for number 3, student transportation recommendation motion? And then I have a couple other questions too.
I'm sorry, Barbara, I couldn't hear you. What was your question?
Number 3, it says student transportation. Can you explain what that's about? I think there's a few drivers that's on, and I had other questions besides that also.
Yes, that specific recommendation really pertains to our non-public school students. We will not be offering transportation. We are not required to do that since we are not offering transportation, obviously, since we're closed right now, to our regular students. So we are not obligated to offer it to our non-public school students either. And we ran into a concern with the number of drivers as well as the number of runs, and that's why we made that recommendation, and it's on the agenda for tonight.
And is that also for the special needs?
We have not yet made a decision about transportation needs, but you'll see the backup for that agenda item does exclude special needs students. So if we determine that we must bring in special education students as per their IEP and that they are in need of transportation, the backup information for that particular motion cites the fact that we can do it for special needs students.
Okay, 2 more things, I think. How are the drivers being taken care of as far as financially? Is the district going to pay the drivers like they did in spring?
The reason that drivers and other workers in the district, such as food service workers, support nurses, and so forth, instructional assistants, if they were not working, were being paid was because of a state mandate. We have not made any decisions about what we are doing in terms of unemployment or work for drivers. Obviously, our first goal would be to try to redeploy some of our particular staff members in the support staff in order to try to provide them with work. But unfortunately, if we cannot redeploy them, then we would have to look at other means of either furloughs or demotions.
Okay. Number 7, it says anti-bias, anti-racism training. It says for administration and staff. Does that mean all staff in the district, or is it just teachers?
I believe that's for the professional staff. Dr. Lucky has been working with us all this past school year. Her expertise is in English and language arts. I believe there is one session that is open to all staff, but other than that, she's going to be working primarily in curriculum-based areas with teachers.
Okay, because I feel as though as drivers, and we interact with the students. We're like the first ones they see and the last ones they see of the day. Drivers hear a lot. We see a lot. It don't seem like we're offered that opportunity for training.
And thanks, Barbara. That's an excellent point. And we are looking at different kinds of training opportunities for all of our staff members.
Okay. I guess that's it. Again, with the transportation, talk about reevaluating when time to open. It just seems like there's no way to really social distance students on a school bus. I drive one of the bigger ones. So how do you reevaluate that?
Well, that's obviously a significant concern for us. And that's one of the reasons that caused us to really reconsider our decision to reopen at this time.
Okay, thank you.
Thank you, Barbara. Mike Parsons? If you could unmute, Mr. Parsons. Okay. Mr. Parsons, can you hear us? We're not hearing you at this point. Mr. Parsons? Okay. Rich, can you assist with tech support?
I would say that it's something with Mr. Parsons' microphone.
Okay.
He is unmuted at this time, but I don't see any traffic coming through.
Right. Okay. All right. He dropped off. Carissa George?
Analyst coming in again.
Okay.
Hi. I'm on a senior this year, and I would just like to speak on the virtual schedule that was sent out today. I know someone earlier mentioned asynchronous learning, and it was said that it wasn't an option, but I think it might also be unrealistic for some students to be able to join 4 hours of Zoom calls a day. And I hope that's just something that's being considered, especially in some of the underlying things I was reading about it being required for cameras to be turned on. Like, I know me and as well some of my friends weren't comfortable using cameras during the day, and I just don't know if that should be required. And that's all. Those are just some comments that I would like to be considered while making edits to the virtual plan later. And thank you for all that everyone's doing. I know it's a difficult decision. So that's it.
Thanks, Carissa.
Thank you, Carissa. Okay. Matt Corcoran?
Another panelist.
Okay. Hi, Matt. You need to unmute.
So
there you go.
Thank you. Yeah, thanks. Yeah, thanks for taking the time here. I appreciate it. I'm on Stanton Avenue. So my understanding is that the big issue is there was too many students. It sounds like too many people wanted to come back to school. Is that correct? And that was what switched it over?
No, that's one of the considerations that we had, was the inability to safely socially distance students in many of our classrooms because of the numbers that are in the class sizes. That was one factor, but certainly not the only one.
Matt, I think you're frozen. Your connection does not seem.
Like you said, your plan was to come back at the beginning of the season, at the beginning of the school year. So I assume there wasn't a surge of population.
I'm sorry, I couldn't hear what you said.
So do you hear me right now?
We do now, yes,
okay.
But you couldn't hear you before.
Okay, sorry. So you just said that we couldn't social distance, but at the beginning of the summer or end of the spring, we were going to come back. So what changed then with the student population?
Well,
Did it
what happened
surge?
was when we looked at the scheduling and the number of students that we had, we found we couldn't do it. We had every intention of trying to make it work, but there were a number of factors, including the number of students in classrooms. When we actually sat down to doing the work to make it happen, and we measured classrooms and we physically put desks in classrooms, we found, for example, that in our elementary classrooms in our new building in Enfield, we could not fit 16 or more desks and keep them any more than approximately 3 feet apart. So even though we had every intention of trying to make it work, when each building principal began to examine all of the logistics involved in making it work, we found it was very challenging. At the middle school and the high school levels, we were able, because of a hybrid schedule, to split the kids into socially distance in the classroom, but we still would have had hundreds of children walking in the hallways at the same time, and it would have been challenging with only 2 or 3 building administrators to ensure that students would stay safely apart in the hallways as well. That was one of the factors that we looked like, not the only one.
Okay, and then the panels at the beginning mentioned there's no data from, we don't have people in school, but certainly we can look at we can look at day camps, we can look at daycare centers, and particularly in Montgomery County, they're very positive, meaning in a good way. They're not positive rates of COVID. So there is data to use if we want to look outside Montgomery County, or even within Montgomery County, but at schools. They don't necessarily have to be in the United States. So I'm a bit confused why there's, if we're not going to open school, what is the bogey? Where, because as parents, we want to know, what do we have to do to go to school? Because we're going to, I want to know, hey, we hit this number. Why aren't we opening? I want to, we want answers. Because right now, we have.
Mr. Corcoran, your time has expired.
Okay. Mr. Corcoran, I'm not sure if you were on earlier in the meeting. You were, did you, when Dr. Matone and our other guest were on, I believe that the number that they quoted at that time, and those who were listening can also correct me, was 10 cases in 100,000 was the lowest number that they were looking at under controlled spread. And I am not a physician, so I was listening to the information. I'm just repeating that information. And we're, this meeting will be recorded, so it will be available for anyone who had missed that portion of the meeting, where our physician guests had provided some more detailed information about that. So
we're not using
thank you.
CDC numbers. We're using their numbers, their guidelines.
We're using local guidelines. Yes, we're using local guidelines and the advice that has been given to us from our county health department, and the Pennsylvania Department of Education.
So it's 10 per 100,000. That's what they said earlier. I'm sure that's the number.
Okay.
It's not going to change. Obviously, different things can happen, but
yeah,
that's what you're shooting for.
Okay.
Yes.
Thank you. Yes. Mm-hmm.
I'm sorry. I just wanted to jump in
That's
on
okay.
the number, just because I've been.
Sure.
I hope I wrote this down right. I've been trying to keep pretty careful notes.
Okay.
10 cases out of 100,000 is the goal to get to. That's the.
Mm-hmm.
At least what was communicated by Dr. Coffin and Dr. Matone.
Mm-hmm.
Montgomery, our area currently is between 29 and 36.
Okay, great. Thank you. I appreciate that. Okay. Joshua Williams.
Hi. I just wanted to ask a quick question on item number 7. I just wanted to get an understanding of what the board's intention was when it came to having the anti-bias training, like what the goal was.
It looks like Dr. Hacker may have been kicked out, but I'm going to try to speak for her. So under the equity plan that we have within the district as far as equitable practices. We do have a plan for training for staff to further our understanding of the effects of bias and racism in our schools. And we have, I believe that Dr. Hacker has explained that we've been working with Dr. Crystal Lucky with our staff for the last year, and she's now popped back on. So I'm going to let her speak a little bit more about what the goal of that training is.
I think you said it extraordinarily well. Our goal is to continually provide our staff with the resources that they need so that they can understand the unique needs of every single student. We are living, unfortunately, in very challenging and turbulent times in terms of what has been transpiring in our country, and we made a very deliberate and conscious effort to bring someone in that we knew our staff trusted, that could give staff members an opportunity to talk about what has been going on across the nation and to discuss their thoughts about it, and also to discuss with Dr. Lucky their thoughts about how to address this with students as we begin the school year. So this is an ongoing commitment we've made in our district, and it's continuing this year as well.
Okay, thank you.
Thanks, Josh. Okay, Mike Parsons. Mr. Parsons, we're going to try to get you in again. Hopefully we'll be able to hear you. You can unmute.
Can you hear me?
Yes.
Oh, yay. Sorry, some technical difficulties. So
Okay.
I'm on my husband's account. My name's Rachel Parsons. We live on Brent Road in Orland.
Okay.
My question for you today is, under these new circumstances, is the board thinking about, or what is the district doing to keep our Springfield competitive? So I have 2 children in high school and 1 in middle school. So I want to make sure that my kids are staying competitive, staying in the district for college, for their career in academics, athletics, band, esports, etc.
Well, Rachel, I think the best way for me to respond to that is to say that if you've been looking at the countywide data in terms of the number of districts that, like us, have had a recommendation or their board has voted to close, you'll see it's the top districts throughout. Lower Merion, which is a top-rated district, Hatboro, Horsham, Abington, Colonial School District, all of our neighboring districts, Upper Moreland, so forth. The majority of districts in our county have made the same decision. You'll see if you look at county data in Chester County, in Bucks County, in Delaware County. In fact, the Chester County Board of Health has just issued a recommendation that all schools in Chester County and Delaware County close and go virtual. So we are not alone in this. Everyone is really in this region moving towards the same decision, which means it puts us in good stead in terms of our being able to compete with local school districts. We're all dealing with the same issues. And what we have learned as a result of the other experiences from the spring is that there was a way to improve the offerings. And so what we've tried to do is build upon the virtual educational, instructional, and design that we had incorporated over the spring. And so I really believe that we've strengthened that instructional program, and our goal is to try to make it as rigorous and robust as possible as we move forward. And I think we'll be in very good stead to be able to do that and to be competitive, not only with our local school districts, but with school districts across the state.
So I appreciate your answer. One thing I would add, though, is we're not just competing with our local school districts for college and careers. We're also competing with the country and the U.S. And not everyone is making the circumstances or the decisions to move forward the same way. So I would just leave the board with this. There are children that I think are really compromised in our area because of the decisions that are being made. And I hope that the board is working on a strategy to help those children have an advantage now. Thank you.
Thank you very much. Ben Churchill. Hi, Ben. We can't hear you, so I'm not sure if your microphone is working. Yeah, I can hear you now. Go ahead.
Sorry about that. I live at 10 Hillcrest Avenue in Erdenheim.
Okay.
In regards to the Department of Education's requirement of 900 hours, 180 days, so 5 hours per day of instruction, Dr. Hacker, can you go into more detail about the balance of asynchronous learning versus synchronous learning and what your considerations went into the schedules that were provided today?
So Ben, I don't know if you heard me say this before, but those schedules were developed by each building principal in consultation with a group of staff members from their own school. So I can't speak to the specifics of each schedule. You'd have to really ask that of your child or children's building principals in order to figure that out. The 900 hours and 180 days work in tandem. So in other words, 180 days of instruction and a minimum number of 900 hours is required by the Pennsylvania Department of Education. So that's where that number comes from.
Right, but did the Department of Education provide any guidance this year in anticipation of virtual learning?
Guidance in terms of what?
The requirements of what is virtual on Zoom versus what is...
No, the Pennsylvania Department of Education leaves instructional design, even in in-person learning, other than a requirement that we align our curriculum to the Pennsylvania standards and that we prepare our students to take the state assessments, and there are certain requirements in terms of performance on those assessments. But other than that, the Pennsylvania Department of Education does not get involved in terms of working with districts or providing recommendations to districts about instructional design or delivery.
So you're saying that it's up to the principal to decide?
It is up to each individual district in terms of determining how curriculum will be delivered and what will be included in curriculum content. As long as it is aligned to the standards, that's the only requirement. But there is flexibility in terms of designing schedules, yes.
So can the board address the question that I think Allison brought up before in regards to Enfield and elementary school kids versus high school kids? And right now, the schedule that was published today was that there was a minimum of 2.5 hours of virtual learning.
Mr. Churchill, you have 30 seconds remaining.
So the best way, again, for me to answer that, Mr. Churchill, is that I'll repeat what I said before, that the principals, in conjunction with the teachers who teach these children every day, worked on developing a schedule that took into account the request by parents for more live instruction and engagement on the part of the teachers. And they try to create a balance between the amount of live instruction, knowing that children have challenges with their attention spans, but also knowing that children have a need to be together and to socially interact with one another and their teacher. So that schedule reflects what they all believed was that appropriate balance.
Okay, thank you for your help.
Thank you, Ben. There's a question from Shira Gilchrist. I do want to, before Shira jumps in, there is a question in the chat about sharing more information on item number 8, which is the trauma training. And I wanted to know, Dr. Hacker, if you could address that.
Actually, I think the best person to answer that, Rich, I believe Dr. Johnston is present.
Okay.
And if you can make her a panelist, she actually arranged for the trauma training and can give significantly more details than I can on that.
Okay, thanks. Shira, I appreciate you being patient. I will get to you in a minute. Thanks.
What I can share is obviously we have a strong commitment to working with our staff on helping them to recognize the many factors which influence trauma, and particularly during periods like a pandemic. And so we want to be able to address that with all students and to be able to help them in the first week or so of school to be able to talk about experiences and what they're going through. So that's part of the fundamental rationale behind the training. But I see Dr. Johnston is available, so I'm going to let her talk more specifically about that.
Thanks, Dr. Hacker. I appreciate the opportunity. We are working in collaboration with Lakeside Schools Neurologic Institute to provide 4 hours of trauma-informed practice training to all of our faculty. Those 4 hours are 2 hours around trauma and its impact on the brain and brain development, and 2 hours of strategies in which we can design and infuse into our classrooms to benefit all children. Often there's a misunderstanding that trauma is one event that has happened to a child in the story of their life, when in fact what the presenter will share with our team is the way in which different experiences across our lifetime cause some trauma, therefore impacting how students behave and manage their emotions and their behavior and their attention and engagement, not only socially, but academically. And strategies, direct strategies our faculty can use in their classroom, virtually or in person, to address and support students as they work through those issues and be able to attend to the learning in front of them.
Thanks, Damien, for that detailed explanation. And again, I think what it speaks to is we are very conscious of the fact that children have been through so much, as have their families, and children are products of their families. And so we are very cognizant of this fact. I had mentioned several weeks ago in focus groups with parents that we had a strong commitment to being able to allow this time for children to express themselves when they came back to school without solely focusing on academics. So we know that their mental health and their social and emotional needs are very critical, particularly after everything they've experienced. And so this training, as well as some other training that we're doing with staff, is really designed to help staff understand how to listen to their students, how to ask them appropriate questions to get them to vent and talk and express their emotions and feelings, and to be able to give that opportunity for everyone to really have these important discussions about what everyone has been going through. So again, you know, we're very mindful of the fact that children have these significant needs in addition to the academic concerns.
Thank you, Dr. Hacker. Shira Gilchrist.
Hi, can you hear me?
Yes.
This is Byron Gilchrist, husband of Shira Gilchrist
Hi.
on Marshall Road in Winmore. My child will be attending first grade virtually, I guess. But I heard a lot of parents talking about the schedule. And I know you mentioned that you got to address it with the principals. How come they don't get on these calls? Are they not allowed to be on this call? That's my first question.
I believe many of the principals generally do attend our board meetings, yes.
Okay. If you did the polls and you had an overwhelming response that you wanted more interaction from the teachers, the asynchronous wouldn't even exist, in my opinion. I'm the opposite. I want all synchronous. I want them to earn a check. I know the younger kids got a short attention span, but that can be accommodated with more intermittent breaks or something like that, not timeouts for the teachers. So I'm not for the asynchronous. And that's all I gotta say.
Okay, thank you. Okay, there's no one else in queue for speaking at this point. I'm just gonna, oh, we have one more person popped up. Lee?
Hello, can you hear me okay?
Yes, hi Lee. Can you just share where you live in our township, please?
Yep, of course. So yeah, my name's Lee Aberley. I live on 528 Jarden Road in Winmore. I just have a question about, so I have a child in the school district who will be going into 3rd grade. He has an extensive IEP with a number of different services. And I want to ask one question and make just one comment. So after reading the email regarding the schedules for in school, there's a separate section for those children that have special education, that are part of the special education program. And I was unclear as to when it says the children will be following 2 weeks of virtual learning, is that 2 weeks virtual learning as stated in the building education plan, or is there going to be a separate education plan for children that have an IEP? I was a little bit confused as to what that first 2 weeks, and he would be eligible for that first 2 weeks monitoring because he was in ESY over the summer.
Damien, are you still on? Would you like to respond to Lee's question? I think I know the answer, but I think it would be better coming from you.
Sure, Dr. Hacker, I'd be happy to. Hi, Lee.
Hello, Damien. Thank you.
Absolutely. So one of the things we're trying to figure out is we certainly recognize that some students with disabilities and others, I'm sure, but for certain students with disabilities are going to require more intensive interventions than are possible to meet your child's needs or children's needs through this virtual model. And so we're going to use the first 2 weeks, 2 to 3 weeks as we reacclimate. But because we've exponentially changed the schedule and the design of the program, we need to figure out which children, sort of how children are responding to that. I'm sorry, I'm losing my train of thought. How children are responding to those interventions that we've put in place with our new plan. So we're following the building schedules for the first 2 weeks and doing baseline data collection, which is gathering more information on how the students are performing towards their IEP goals. And then at that point, we're going to take a look at that data with your child's case manager.
Okay, so do they get the services as part of that 2 weeks? So things like OT, PT, speech, they still get that in those 2 weeks?
Absolutely.
Okay. And I just, okay, that's really good to know. Thank you. And I just want to make one comment. Of all of the services, I've got to say that PT is one of the hardest things to do over a Zoom call. That is the most challenging thing. We had spring was rough, ESY was better, but PT is very, very challenging over Zoom.
That's really good feedback, Lee, and I'll share that with the therapist because we'll have to think about what our options are. How's that?
Yeah. Thank you. Thanks,
Okay,
Damien.
sure,
Thanks,
of course.
thanks
My
everybody.
pleasure. Glad I can help.
Thank you, Lee. Jared Epps.
Hi, this is Melissa Epps. Can you hear
Hi.
me?
Yes, hi, Melissa.
Hi. I was in contact with Dr. Hacker earlier this week via email, and I guess basically what my main concern was that the survey that was sent out to all of us asking what our concerns were sending our kids back to school, and the overwhelming majority based on the last school board meeting was that roughly 70% of us wanted to send our kids back to school. And, you know, in Dr. Hacker's reply, and it was very prompt and I greatly appreciate that. It was, you know, the decision, she said that, you know, she understands that it's a hardship for many families, but it was not solely based on parent input. And, you know, the decision to go virtual was inclusive of knowledge of how staff members would be able to accommodate going back to school due to their own immunocompromised medical concerns and various issues of that sort. But, why even send out the survey is my point. 70% of us roughly wanted to send our kids back to school. So that's an overwhelming majority. And, it feels like it's falling on deaf ears.
So, Melissa, let me answer that by saying that a survey is not a decision-making tool. It's a method for gathering data. And the data that it revealed to us, because there was an overwhelming majority, approximately, as you said, it turned out it was actually in the high 60% of individuals indicated they would be returning their children to school. What it actually told us, which was a significant piece of data for us, was that there was no way that we were going to be able to significantly reduce the number of children, particularly in our elementary school classrooms, in order to be able to achieve the level of social distancing that we felt was really critical, and that could also reassure our staff members that they would be safe in a classroom setting. So unfortunately, while it would appear that when you have an overwhelming majority of people saying we want to come back to school, therefore you should open the schools, what actually happened was that piece of data told us with that many people coming back to school, our class sizes would be way too large in order for us to be able to safely bring students back into our classrooms, particularly at the elementary level. What we were hoping to see was that if we could reduce the size of the number of students in each of our elementary classrooms significantly, we'd be better able, given our classroom sizes that the principals had measured, to be able to spread the desks out more easily. That turned out not to be the case.
Right. So with Enfield, the old Enfield, I should say, being vacant, so that's still not an option.
No, even with the old Enfield, it wouldn't matter where you moved the kids to because you'd still have the same number of children, whether it's in a classroom at the old Enfield or the new Enfield.
So not even a hybrid option?
As of this point, we did not consider a hybrid option for elementary school children because we felt, because of their developmental level, that if we were bringing them into school, it was important for them to be in school 5 days a week.
Okay, I'm just, most of these kids that are coming into kindergarten had some form of preschool, education. And, they're used to being, maybe not in preschool full time, or maybe they are, most people can't afford preschool full time. They're used to being juggled around in some sort of fashion. I think that, especially for younger kids, they're more adaptable and could handle more of a hybrid option since.
Excuse me, Mrs. Epps, you have less than 30 seconds remaining.
Okay, thank you. I just think that it's such a disservice, to the kids, especially at these young ages when they're so impressionable, to not be in school with their teachers. So thank you.
Thanks.
Thank you. Lauren Reagan.
Hi. So I have a son that's going into Enfield. He's doing his second grade, and I just want to know what training have the teachers received to help this whole virtual process? I know the end of last year was, everything was put together very fast, so there was no training. What has been done over the summer, or what is going to be done before the start of the school year, so that this can, go as good as we can hope?
So, Lauren, can I assume that you just joined the meeting and didn't hear my response to that question?
I was on and off because I had other things, so I didn't hear, if someone already asked this.
Yes, somebody did, but I'm happy to answer it for you again. They've received a significant amount of training. They have been involved in study over the course of the summer about enhancing virtual instruction and particularly engagement with students. as well as instructional design. At the last board meeting, the board actually approved modules that every teacher is going to be taking. It's over 6 hours of instruction with the Montgomery County Intermediate Unit that is based on classroom management in a virtual environment, how to keep students engaged, instructional design and delivery, and also assessment practices as well.
Okay, so I'm not trying to be rude, but I do have some friends who do teach in the district, and unfortunately they feel completely different from what I've heard. They said that they're in the dark. They haven't received the training that you're saying that they did.
It hasn't started yet, Lauren, that's why.
So it's gonna start, so we start school in, we start school really soon. So why wasn't any of this prepared for over the summer or the end of last year?
Because the teachers don't work over the summer. They come in the full week before school opens, those 4 days, Monday through Thursday, and that's when they will do this training.
Okay, so they're gonna receive 4 days of training?
Yes, we have 4 days of professional development and opportunities for the teachers to prepare for the school year. That's correct. That's part of their contract.
Okay, and that's gonna teach them how to use the technology to the best of their ability as well? Because I feel like last year was a learning process for everybody, which is completely understandable because it was thrown together under such short notice. But I think a lot of the issues last year was the teachers also getting used to the technology. So they're going to be taught that and best practices for keeping kids, keeping their attention, how to keep them not from sitting still the whole time. They have to move a little bit. These are elementary school kids. They're not going to sit in front of a computer for that long. They're going to be taught all of that in 4 days?
Yes. They've also had professional development over the course of the summer as well.
But you just said they don't work over the summer, so that's why I'm confused.
Not every single day, that's correct. But they also have what is called Summer Learning Academy days over the summer.
Okay, thank you.
Thanks, Lauren. Lindsay Hamilton. You could unmute, Lindsay. Lindsay, can you unmute your microphone? Lindsay, if you would like to speak at the meeting, we're going to need you to unmute.
Karen, I think she said she didn't raise her hand.
Oh, she didn't? Okay, her hand is raised in the attendee section. Sorry. Okay, thank you. Sorry about that. Mr. Parsons?
Can you hear me?
Oh, yes.
I just have a quick question. This is Rachel Parsons again in Orland.
Hi, Rachel.
Has the vote taken place? I guess I'm confused on some of the answers and some of the emails, some of the communications. I thought the vote hasn't taken place yet, but based on some of the responses, it almost sounds like the vote has taken place.
The vote has
what we're
not
doing for the school year.
The vote has not taken place by the board. What the comments are related to is my recommendation to the board that they will vote on shortly.
And when you say shortly, is that happening tomorrow?
Tonight at the
tonight.
board.
Yeah.
This is the public comment section based on agenda items that the board is going to be voting on.
Okay, just wanted to make sure I was clear. Thank you.
Sure. Okay. Cherie Curtis. Hi, Cherie, you can unmute. Cherie, did you want to speak? Okay. Cherie? We can hear you. You're unmuted now. Did you have a comment?
Wait, no, I'm sorry. Are you talking to me?
Yeah, you had raised your hand in the chat.
Oh my God, sorry, that's multitasking. No, I'm trying to walk the dog and listen to you guys at the same time. No, I apologize.
Okay, thanks, Sherry. All right, Erin Finnegan.
Hi, yes, this is Erin Finnegan again, in Winmore. So if I'm understanding things right, you did the survey, you saw that high 60% of parents wanted to send their kids back to school, and you assessed at that point that we didn't have the availability to socially distance in the school. We heard from the doctors at the beginning that if we get down to the milestone of 10 cases per 100,000 people in the township or in the county, that's one milestone of 3 that they were looking for to reopen the schools. But it sounds like even if we hit that milestone, there's still not space in the schools, so we still won't be able to reopen as long as social distancing is expected.
Well, if that's the case, we may need to look at a different alternative for our elementary school program. At the high school and the middle school level, because we traditionally have larger class sizes, as many as 25, 26, 27 students in a class, that was what was behind the decision to go to a hybrid model if we opened at the secondary level. So we may actually have to look at that at the elementary level as well, where children are only coming in. We were trying to avoid having them only come in 2 or 3 days a week, but now we might have to look at that if we feel that we can't achieve the social distancing we feel is important at that level as well.
Okay. I just have concern. It just seems like conflicting information that we hit the milestones, we can open back up, but then at the same time you said didn't look good.
Again, the milestones, the survey, they're all a piece of the puzzle. Staffing is also a piece of the puzzle. You know, we had numerous concerns from staff who do have immunocompromised conditions, pregnancies and so forth, who were concerned about coming in, and being able to staff classrooms was obviously a consideration as well.
Mm-hmm. Thank you.
Thanks, Erin. Amy McKittrick. Hi, Amy. You can unmute. Amy, if you would like to speak, you can unmute. Amy, did you want to comment at the meeting? You're on the call. Amy? Okay. Mr. Oliver? Could we get some assistance? Thanks. Annie Madden?
Hi, good evening. Can you hear me?
Yes.
My name's Annie Madden. I am a rising senior at
Hi,
the high
Annie.
school. And I'm late to this meeting, so I apologize if this question has been asked. But in the case that the teaching would be virtual, will the teachers be teaching from their home or from the classroom?
Annie, they have the option of coming into the classroom. What I've heard from most of the secondary school teachers is that they actually prefer to come into the classroom. They have their technology, they have their supplies and materials. So while we are not requiring them to physically come into the schools, what we've been hearing from staff is that the majority plan to do so.
Thank you so much.
You're welcome.
Thanks, Annie. Madeline Watson?
Hi, I'm back again. I wanted to know, you spoke about, what was I saying? Oh, I'm sorry. You talked about the training of the teachers over the summer, that they didn't have any.
No, I didn't say they didn't have any.
You said that they were off during the summer, and you said that in 4 days they were going to learn how to teach our children the trauma, the engagement over the computers in 4 days, along with whatever camp you said they went to. But I have a daughter going into first grade. There is no way she is going to be able to learn. She lost half of her kindergarten year, and now she's losing however much of this year. And it seems like it's just because you're scared. The teachers want to come back, the parents want to come back, the children want to come back, and there's no plan for the teachers to teach virtually that's going to work. None of these young kids are going to be able to sit there and do all of this work, have the attendance, and stay in front of a screen for 6 hours a day. It's ridiculous.
So I'm not sure if what your question is.
If everybody wants to come back, why are you choosing to stunt these children's growth?
Well, I think we already answered the question about the number of factors that we had to take into consideration before making a decision. I do want to clarify that every single year, all of our teachers have 3 full days of summer learning academies that normally take place in June at the end of the school year. This year, the teachers had the option to take those days throughout the summer. Several of them did take training in virtual instruction and worked on improving virtual lessons for that reason. And we always have 4 days of professional development before the school year begins.
So in 7 days, an entire school district is learning how to virtually teach all of our children instead of you just opening the schools like everybody wants.
Madeline, I hear your frustration, and I understand that it feels like this may not be enough preparation, but I have confidence in our teachers. Number one, they have been teaching our children for a very long time. They teach every day, every year.
Well, if they can learn it in 7 days, then why did they spend 3 months and it was a total crap show?
Okay, Madeline, I think that we're approaching the end of your time. I appreciate your comments, we really do. We are working, as Dr. Hacker said, on a virtual learning, developing our curriculum.
You could
Madeline,
at least do hybrid.
Madeline, thank you very much for your comments. We're approaching the end of that time. Thank you.
Less than 10 seconds remaining.
Yeah. Okay. Jessica Williamson?
Hello?
Yes. Hi, Jessica.
Hi, can you hear me okay? I'm on headphones.
We can.
Take them off.
Yes,
okay.
we can.
So, hello everyone. Thank you all for spending your whole night here doing this. My question, call me a pessimist. What if this doesn't work? What if it's miserable? What if the kids are having a terrible time? What if this just doesn't work? What is our plan? Are we going to be able to modify this as we go, or are we just stuck with this for now?
Well, I think Jessica, we'd already said that our plan was to reevaluate what was happening during the coming months. Certainly, we will reevaluate the increasing number of cases that appear to be on the rise, as the doctors mentioned at the beginning of the meeting, and look for a time when we feel that we can have, hopefully, a more stable period of time without an increase in the number of cases. We've also already said that we'll take another look at the possibility of reopening, but perhaps altering the plans that we had made previously in order to be able to achieve in a better way some of the measures, such as a wider spread between desks and greater social distancing, which we felt we could not accomplish before. That might make teachers feel more comfortable as well about coming back into a school environment. So we have to look at all of those factors as we reevaluate the decision over the course of the coming weeks.
So I guess my question, I mean, I did hear you talking about, how the metrics that we're looking at to reevaluate. So I guess my question is, if we're not there yet, if those metrics aren't if we're not where we need to be yet, and it's just not working for some significant portion of these kids, is there a pivot that we can make before we hit those numbers if it looks like this just isn't working, or do we just have to kind of wallow for 4 months or whatever it is?
I'm not sure what you mean by a pivot.
I mean, so say in a month, everybody's miserable and half the parents have lost their jobs and their homes are up for sale, or they're, losing their rentals, or whatever the case may be. Or the, special ed kids are just not learning anything and the mental health is suffering. I mean, if all of that comes crashing down, and I'm not saying that it will, I'm just thinking, what are we going to do? Worst case scenario. If all of that happens and we're really, really struggling and we're not finding success with this.
Ms. Williams, less than 20 seconds remaining.
Okay, thanks. Do we have an itinerant plan before we're allowed to go fully back? Can we consider a hybrid option? Is there something else we can consider?
I think we already said we would definitely consider a hybrid option for all students.
Okay, thank you.
Okay, Madison Dunlap.
Hi, this is actually Melissa Dunlap. How are you?
Hi, good. How are you, Melissa? Thank you.
Good, thanks. I am wondering about the students. Some of our high school students are very mature and they have heard a ton of things about online, not online, virtual versus hybrid. And I'm wondering the plan to include them as near adults, if you will, and when they will learn about the changes in teachers, which has already happened. Their roster came out and then some of the students have different teachers now and things like that. What is your communication plan to the students?
That's really up to each building principal in terms of how they get that information out each year. I can't respond on behalf of Dr. Rittenhouse in terms of how he communicates. You mentioned teacher changes. I wasn't sure, Melissa, whether you were talking about new teachers on their rosters or what you were exactly referring to.
Yes.
Okay, yes. There are certainly, we've hired a number of new teachers for the year because we did have a significant number of retirements. So again, that's typically information that Dr. Rittenhouse shares. I'm not sure exactly how he does that every year, but it would just be done again this year virtually.
Okay, I think it's just very important to include them so they feel a part of this and really feel like they're, engaged in the process of the new year, virtual versus not. So that's just my opinion. Thank you so much.
Thanks.
Okay, as we're getting down to a few speakers, if there's anyone who's already spoken, I would ask that you yield some time to folks who've not spoken already. I see Amy McKittrick is on again. I know we had you in, Amy, the last time, but we could not hear you. So just wanted to give you an opportunity. Amy, can you unmute yourself? Did you want to speak?
Hi, I think that you have me, Pam McHugh, in as Amy McKittrick when I am in fact Pam McHugh.
Okay.
So I don't want to speak for Amy. I'd like to speak for myself.
That's fine.
First of all, thank you, Dr. Hacker, and all board members for everything that you've done to get us all through this amazingly difficult situation. As parents are trying to figure out how to support their kids through this time, the idea of pods has come out. And I guess what I want to know is, do you have any suggestions about how we can, on the outside,
best support the teachers and kids while we go through this epidemic?
So Pam, is your question specifically related to pods, which by the way are an excellent way for parents to share resources, to alternate, for example, who's going to be supervising students as they're learning together at home? It's a great way if parents are willing to have children in the same home to be able to have children have some social interaction. So if that's what your question is, if it's about learning pods, they're an excellent way to affect all of those things. Parents can alternate if they have different work schedules in terms of in whose home the children are, particularly if they have part-time work, they can share that. They can also have children work on assignments together and help each other answer questions for one another. They've got that social interaction. It really all depends on personal preferences for parents in terms of their levels of tolerance for bringing children together in the home.
And I understand that. I guess my bigger question is, do you think that it's important for kids to be online with their teachers and then have support on the side?
Well, additional support is always helpful, and one of the things that we've been very intentional about doing is creating parent learning guides and resources that are going to be sent out before the beginning of the school year. So we will be offering text support for parents who want to know more about the technology resources that we're using, such as Google Classroom, Google Hangout, Seesaw at Enfield, and other resources. We're also going to be able to offer parents additional resources to assist with the specific content areas as well. So the answer to your question is, of course, we always feel it's important for parents to be in the loop and to know what resources that they can use in order to be able to help their children along with us.
Okay, again, thank you to you and to all the teachers for everything that they do to make this difficult situation better.
Thanks, Pam. And for those of you who don't know, Pam retired. She was a wonderful teacher in our district a few years ago, a very valued member of our staff. So it's great to see you, Pam, and to know it's you and not somebody else.
If there are folks that are in line to speak that have their hand raised who've already spoken, again, I appreciate you yielding some time to those who have not already spoken. Andrew Myers.
Hello, can you hear me?
Yes, we can.
I appreciate you setting this meeting up and giving us time to discuss our concerns tonight. I guess one concern and one question. I guess one concern that I've had has been the communication from the school district. I feel, probably you may have sensed from the repeat questions tonight, that there hasn't been a lot of information shared, which has made it difficult for us as parents to kind of plan and prepare our students. Mm-hmm. So I just hope going forward that that's something you consider improving and providing more information. And I did mention that TRAT setting up a frequently asked questions, because I know a lot of information I've gotten has also been through social media where the school district has been prompt in responding to questions, but people are posting that because people have similar questions and they're only getting that through secondhand knowledge. So I would appreciate more thorough communication. I think you've heard questions about the reopening. It would have been nice to know my kids were getting an iPad, so I didn't go out and buy computers last week. So just things like that would help us as parents prepare better. So I would appreciate improvement in that area going forward. My second question is related to the schedule. You mentioned you're allowing the individual principals to manage that. I know other school districts have done it, and it would have been nice if we were able to do it, have setting up the same time schedule for students in different schools, including the same lunch period, because that, while this is a difficult situation for everybody, it's definitely making that more difficult for me and my spouse and the parents that we're trying to connect with to manage virtually schooling our parents from home. So I just wanted to know, was that considered or thought about?
In terms of the individual building schedules, I believe that each building worked on developing a schedule that was similar to what they had in place for in-person learning.
Yeah, no, I understand that. I was just wondering, did they consider possibly changing that for the virtual differences in instruction and synchronizing that among the schools? Because it definitely presents a challenge for those of us who have children on different schedules and go at different times.
Yeah, I think it's really hard to do that because the schedules, particularly coordinating those between the secondary level and the elementary level, they're on totally different timetables. The elementary schedule, remember you have one teacher, and so the way that they do their lunch schedule is very different, whereas at the high school and the middle school, they're on several different classes over the course of the day, so their whole schedule is based on a different timetable.
No, understood. And this is secondhand knowledge, so I can't verify for sure, but I believe I was told the Upper Dublin School District did synchronize all their kindergarten through 12th grade start and end times and lunch period. So again, I can't confirm that because it's secondhand knowledge, but it sounds like other local school districts were able to figure that portion out, which would be a great benefit if we could figure that out for the second half of the year.
Thanks, Andrew.
Thank you.
Okay. Mike Searman, I do know that you have spoken before, but we'll open it up if there's a last quick question.
No, I spoke before when you limited me only to questions to the doctors.
To the doctors, okay.
I did. You told me I'd have a time later to speak. So.
Okay, sure.
First thing I'd like to comment is what we're seeing in this meeting here is what I would expect to see during the class period. If we go virtual, is not everybody's paying attention. Somebody's walking a dog. People are dropping in and off. Dr. Hacker dropped off. Dr. Hacker came back on. You have the solicitor jumping on. The sound quality in between various people speaking. Some people's microphones work. Some people's don't. I would expect this to happen every single day in every single classroom. You're going to run into these problems. But question-wise that I have is if the vote is going to be to go to virtual, I would wonder if there's any consideration to amend that to allow the individual principals and administration for each school to allow various small groups to come into the school for either special education learning or even in the upper schools for science labs. I mean, how can you have a meaningful chemistry class with the chemistry lab while you're working at home? I don't have the equipment here for the kids. I'm sure all the science labs, if they could work into the virtual motion, that the principals will have the discretion to allow small groups of classes in for labs or special education. I think that would be a little bit more palatable to a lot of parents.
Michael, as we had mentioned before, I don't know if you heard me say that all of the building principals, when we have our meeting tomorrow, are going to be talking about creating those kinds of opportunities for students to come in. They all have the discretion to do that at any point.
So even if we vote virtual, that doesn't have to be in the motion. That will.
No, that does not have to be. That does not have to be a part of the motion.
Okay. Thank you.
You're welcome.
Thanks, Mike. There's someone listed as Stroll.
Hi.
Hi, can you state your name and where you live in the township, please?
Yeah, it's Caroline Stroll. I live in on Queen Street in Winmore.
Okay, thank you.
I just wanted to know if there had been discussion yet about when the children do, hopefully, of course, go back, what will happen to the online learning for those families that can't take the risk to go back? Does everything end? Have we got a plan for that? Because obviously the teachers won't be able to do both.
So our original plan was to be able to offer both, because what we had heard from a significant number of parents was that if we did in fact open, that they were not comfortable sending their children back to school under these circumstances. So obviously we would have to look at that again and figure out a way by which we could do that. And that's what we were working on originally when we were talking about a hybrid opening at the secondary level and a full-time opening at the elementary level, was a way to be able to include our students with their teachers in the regular curriculum if they were in fact making that important decision to stay home. So yes, we would certainly look at that again, because we know that even if we were to open, regardless of what conditions that would be under, we know that there will still be many families that still would feel uncomfortable sending their children in.
So thank you. So is there at any point you'll reach where we'll be penalised if we can't, or if we, if it's deemed safe to go back, but then, we've got somebody that's really sick in our home, so.
No.
Okay. Thank you.
You're welcome.
Okay, Lindsay Hamilton.
Hi, I think I'm under Lindsay Hamilton. This is Chris McKeever.
Okay.
Hi, I'm sorry.
It's okay.
I was under Lindsay's link.
Okay.
So I just want to thank everyone, especially Dr. Hacker. She has been very instrumental in responding very quickly. But I have a concern. I am a professor at a university, and I, as well as the teachers in March, were forced to quickly do virtual learning at a drop of a hat. It was very difficult. However, we had to do it. Difference is that the university students are paying for this. My concern is that another parent brought this up, that we are going to have our teachers do this in 4 days of virtual learning and getting our students ready. It's pretty much impossible since I've been doing this since March. So my question is, how are we going to prepare our students to be engaged, especially at the middle school and high school level, to be engaged and to be online with 4 days of learning for the teachers?
So let me just clarify something about the 4 days. I certainly don't mean to imply that our teachers haven't been on their own working to shore up their plans for virtual instruction throughout the summer. They simply have not been required to physically come into the buildings to attend mandated training, other than those SLA days. But many of them have been working very, very hard along with our instructional coaches on shoring up what they are learning. So I certainly don't mean to imply that because they're coming in for those 4 days, they haven't thought about virtual instruction over the entire period of the summer. I think all of the teachers ended the school year knowing that they really wanted to be able to do a better job if, in fact, we went back to a virtual environment. And so they all have been working hard, but of course on their own time, not physically coming into school and going through any mandated trainings other than those summer learning academy days, as well as the 4 days of training.
Okay. So another question.
Gary,
I know
you
I
have
only have
15 seconds. You have
Okay,
15
15
seconds remaining.
seconds. So the other question is hybrid. Has anybody thought about outdoor schooling, which is totally possible in the 3 months before the next flu season?
Yes, actually, we have talked about that. And when we originally had plans for trying to open, all of the principals discussed that. All the principals talked about the option for using the courtyard at the high school, as well as even the fields. We looked at all of our schools. Unfortunately, Erdenheim actually has the least amount of outdoor space. And when you're talking about, 30 some teachers who are thinking, can I take my class outside? There isn't really room for everybody to do so on a continuous basis. So have we given thought to it? Yes, the answer is yes. And certainly if we were back in person, that's something that we would have tried to have done on a staggered basis.
Okay, thank you.
Thanks, Lindsay. Okay. We have no more speakers, so we're going to move into the agenda at this time. And I thank everyone for the time that they spent to listen to the comments, to respond to comments, to ask questions, and everyone that has been making comments in the chat. I'm hoping that we will be able to capture that chat and do an FAQ because there have been some overlapping questions that we have had. Okay, great. So moving on through the agenda, approval of minutes, June 2nd, 2020, interim Zoom meeting, board minutes S, and June 16th, 2020, regular Zoom meeting, board minutes T. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions? Okay, Mr. King?
The motion has been read and seconded. All in favor, say aye.
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 All opposed? The motion carries.
Okay. Approval of Treasurer's Report. Treasurer's Report K, June 2020. Treasurer's Report A, July 2020. Is there a motion?
Motion.
And a second?
Second?
Any comments or questions? Okay, Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? The motion carries.
There is an administrative report on the agenda. Dr. Hacker?
Yes, thank you, Dr. Taratusky. And I don't want to take up too much more additional time, but I would like to make a few comments. First of all, I know they're no longer in the meeting, but extraordinary amount of thanks go to Drs. Coffin and Dr. Matero, who, as we said before, is one of our very own. She's a Flower Town resident, for sharing their expertise with us and their wisdom and their knowledge of the facts surrounding this awful virus in our area. If any of our attendees were not able to hear them, they are CHOP physicians and epidemiologists, and I've participated in a number of webinars that they've offered. They've been attending many different board meetings, and we're very fortunate they were able to be with us here this evening. So I just want to take this opportunity to thank everyone. I know this is very small consolation to you, and particularly if you're not in agreement with my recommendation. But I do want to thank you. I want to thank our students who have been here as a part of this meeting this evening, our parents, our staff members, and those who've reached out via email. As you can imagine, between the board members and myself, we've fielded tons and tons and tons of emails over the past several weeks, particularly during this last week when my recommendation went out in the communication to the community. I want to thank you tonight for not only sharing your support or your concerns, your viewpoints and your opinions, your ideas, your recommendations, other news items, research that you found, but also for doing so in such an articulate and respectful manner. We greatly appreciate this. We know that these are agonizing choices that need to be made, and that many people, regardless of what decision the board was going to make or what my recommendation was going to be, was going to disappoint a large number of people. That's just part and parcel of this terrible decision that we have to make during these terrible times. There are many districts in our area that have struggled with exactly the same issues. Their board meetings have been lengthy as well, with people voicing their opinions. Everyone has been struggling to try to do what is best. And we know that there are many unanswered questions, and there is no perfect answer to all of this. Any choice that we would be making tonight would be a difficult one because let's face it, living in the times of a pandemic is not easy, whether it's with our personal lives or with what we have to do as educators. So whatever the board's vote is that's going to be coming in the next few seconds, the one thing I can guarantee is we are going to all work extraordinarily hard to focus our energies and our efforts on making this educational experience for all of our children the very best that we possibly can under these circumstances. We know there are still many, many questions to be answered. We welcome those questions. I'm going to be working tomorrow very hard to help our administrators understand that we have this obligation to help you as our community members feel reassured about the next steps forward. And certainly we will continue to reevaluate our decision-making process over the next several weeks. And if there are additional changes to be made and we decide it's time to safely bring students in, we're going to look at how we safely can do that as well. So thank you for letting me simply have my last word on the subject, and now I'm going to turn it all back over to the board.
Thanks, Dr. Hacker. Okay. So, new business. Number 1, pandemic emergency resolution. Recommended motion. The Board of School Directors approves the resolution declaring a pandemic emergency under Section 520.1 of the PA School Code and for the School District of Springfield Township to implement instructional planning for the 180 days and the required number of instructional hours per grade level as defined within the PSC Section 520.1 Attachment A. Is there a motion?
Motion.
Is there a second?
Second.
And any comments or questions from the board?
May I make a comment?
Yes, thanks, Mr. Lapidus.
So first of all, Dr. Hacker, thank you for finally bringing over 300 people to a board meeting. I've missed it, so it's wonderful. But I did want to kind of echo what you just said. I don't think it's an easy, certainly not for me. It was not an easy decision to go virtual, not go virtual. And I just wanted to express my gratitude for you doing the research. And it's not a simple decision. It wasn't, there are probably hundreds of factors to consider. And I know that it's never going to please everyone. I just want to make sure that people understand that it's a decision made for the greater good of the district, the employees, and all the support staff, and not necessarily to benefit one group or another. So thank you for all the research you've done, and I really appreciate it.
Any other comments or questions from the board?
I'd like to make a comment.
Thanks, Mrs. Spinsky.
I just wanted to let those of you who are on this call and also any of the people that are watching the recording know that this has truly been an agonizing thing for me several weeks. The pros and cons of hybrid and virtual based on the thorough information being gathered and shared with us by Dr. Hacker. Recently watching schools that have reopened just go turn around and have to close again is very discouraging, and it would be a lot of to go through if we would have to do something like that. I really do feel like we could have perfect, safest setup and teachers to resume in-person learning. However, we really can't control what happens at school. And I think that is where the risk and where specific concern is. I've had a lot of emails, as Dr. Hacker said, and I haven't been counting, but I feel like we've had an equal number of pro-virtual, the same as this really isn't a situation for anyone. I think that all really would love to have our students go back to school, but at this time, like the risk is too great. I know people lost loved ones
COVID, it's a terrible way to die. And I can't, in good conscience, put any of our community at risk of having them become ill and die. So I hope, I don't know where we're going to end with our final vote, but I would hope that once there is the decision is made and path forward, I hope that we can remember to be kind to each other and find a way to come together as a community so that we can support each other and our families and our students as we move forward to something that is truly unknown for all of us. Thank you.
Thank you, Mrs. Lipinski.
Dr. Teretuski, I'd also like to say something.
Sure, Ms. Sarfield.
So I'd like to thank Dr. Hacker and all of the administration for all of their hard work that has gone in to making the plans earlier on, and all of the research that they have undertaken, in particular Dr. Hacker, to, you know, I know it was not an easy decision to kind of pivot and decide to go virtual because we know, you know, what the impact is for our community. I'd also like to thank everyone that has taken the time to write to us as a board and who has come to talk to us tonight. I echo everybody's comments that, you know, this is such a challenging and unprecedented time for our community and for our nation. I know that it's, you know, ultimately everybody that came to speak to us as a board, it's personal, right? I mean, and it's personal for many of us as well on the board. I want everyone to realize that, you know, there's a majority of us on the board that are impacted. I myself have two rising senior, I have a rising sophomore. So it's not, you know, this is not a hypothetical decision. This is not a distant decision. It's a decision that impacts my family as well. So, you know, it is not an easy decision. And it is not a decision that any of us would like to make. You know, as many people have said, you know, we would like for this not to be happening. Unfortunately, COVID is making the decisions for us. And we can only adapt and make the correct decisions that we can live with and that we feel is right and is correct for us and for our community. So, you know, towards that, my belief that, you know, the best evidence, the current realities of this ongoing pandemic, you know, the best approach is for us to protect our students, our staff, and our community at this time. And, you know, I realize that it's not the best, but it's the best that we can do right now for the protection of our community. So, thank you.
Dr. Teretuski.
Sure, go ahead.
Yeah, thank you. So I greatly appreciate the hard work and dedication of the administration, the faculty, the staff, as they've worked to formulate and prepare safe and substantial solutions to address the education of our students. I've been paying attention to the professionals, the healthcare providers, all the studies, our government leaders at every level, the feedback from stakeholders in our community. I understand that virtual learning, regardless of how individual experiences may vary, is not an equal substitution to an in-person education. The argument that our children need social interactions for developmental reasons is strong, especially considering the elementary age students. I acknowledge that our most vulnerable students with specialized learning needs or limited resources are greatly disadvantaged by any scenario that does not get them back to a pre-COVID learning environment. Like many others, I too want to return to a pre-COVID environment and send my own children back to school. However, I'm concerned that by opening for in-person education at this time, even with a hybrid model, we would be taking an incalculable risk. As a professional pilot, it was once my job to take calculated risks every time I went on a flight. Each mission started with an assessment of the aircraft, my own fitness to fly, and the current and expected flight environment. including weather, terrain, airspace, etc. The goal was to make a go, no-go decision based on the facts while assessing the potential failure points and trying not to succumb to what we call get there-itis. Basically, you don't go into weather that you can't confidently handle or with equipment that is not suitable for the anticipated flight environment. While I took great care to make the right call on every flight, there were times that I found myself in questionable situations. Thankfully, I always managed to return safely, whether by chance, by training, or a little bit of both. Too many have not been so lucky. Do we really want to put lives at risk because of get there-itis? Beyond understanding the very real need for our children to return to the classroom for a proper education, I've listened closely to arguments urging schools to open so that parents can return to work. I acknowledge that some families need more help than others. The families of essential workers are just one example. However, our mission to educate students should not be confused with a mission to provide daycare services. Schools do not exist to prop up industry and government. Just because businesses want to return to normal does not mean it's actually safe to do so at this time. The White House has mandated random testing for staff in the executive office to, quote, protect the health and safety of the entire White House complex. Major League Sports are utilizing testing as part of their efforts to get back to the business of simply providing us with entertainment. Even with that testing, teams are struggling with outbreaks. Some players have stated publicly that they would prefer daily testing over the current regimen of every other day testing. At this stage in the pandemic, how can we expect to safely return to in-person education without something on par with daily rapid testing, without the right equipment for the environment we are attempting to navigate for our students? There will be many negative long-term effects of this pandemic. The education of our children has already suffered and will continue to suffer regardless of the decision we make here today. This is an unfortunate setback that our society will struggle with, but we will overcome it eventually. Even acknowledging this setback, I believe the risk of staying home is significantly lower than the potentially catastrophic risk of returning to the classroom at this time. Thank you.
Thanks, Mr. DeFranco.
Dr. Taratusky?
Yes, thanks, Dr. Etlin.
I'd like to first thank Dr. Hacker and her administrative team for all the hard work that they've done to bring us the facts, to bring us the important data that we need to assist in a decision. I also like to thank the community members as well as the many parents who have heard from, who have expressed their recommendations, their opinions, and their thoughts. And for that, I do thank you. And your opinions were well taken. This is a difficult decision for all of us. But one thing that I think that you've heard from my colleagues just a few minutes ago that we have to keep in the forefront, and that is the health and safety of all. So therefore, again, this decision is not easy. And I know after this evening is over, many of you will walk away with not being happy with the decision, but a decision must be made. I do have every confidence that the teachers, the administrators will do their every effort in providing the best instruction, whether synchronous or asynchronous, and also to provide the necessary supports that will be extended to all of you as parents. And I too have a vested interest in this decision with 2 grandchildren that attend the district schools. So please bear with us with this decision. And I hope that the district staff will demonstrate their ability to rise to the occasion to support our children the best way possible. I thank you.
Thanks, Dr. Etlin.
Dr. Taratusky? So
Yes.
Say just a few words. I don't want to make a long meeting even longer, and I don't want to keep anyone later than possible, but I did just want to say a couple things. First, I want to thank Dr. Hacker and the administration, my fellow board members, the community for all of your hard work, your input. I just want to say I didn't try to join the board to close schools. That's not what I don't think any of us did. But we have to do the responsible thing, and we have to do the responsible thing for our students, for staff, for the community at large. And based on everything that we've heard, I think that means only one thing. And I think Dr. Hacker's plan to go virtual now and to reevaluate in the fall is, I think, the most responsible way forward. And if I can just say one more thing, and I apologize if I sound angry. It frankly makes me incandescently angry that the full weight of this is being put on our students. And Mr. DeFranco brought up the White House before. It's not just their fault, frankly, and I'm glad this is on the record because I want somebody to know how angry I am about this. It's their fault. It is the Secretary of Education's fault. I know firsthand, because of everything that Dr. Hacker has been doing and her staff, that the Pennsylvania Department has been doing everything it can, but without support from the national government, we can't get anywhere. Look at what other districts are doing. We are all in the same boat. And as I said, the full weight of this is going to fall on, it's being felt by families, but the full weight of this is going to be felt by our students. And I have 3 of them in this district. And I know that the full weight of this is going to be felt by them. And I cannot begin to express how sorry I am about that. That's all I wanted to say. Thank you.
Thanks, Mr. Needleman.
Dr. Taratusky?
Yes, thanks, Ms. Jordan.
Hi. I just want to say thank you, Dr. Hacker and the administration, for all of the hard work that you have done during some really, really difficult times. I have the utmost faith and confidence in our school district, our teachers, our administrators, that they are going to, whatever the decision is, are going to do their absolute best to teach our kids as they have been. And I am totally confident in that. This has been a really difficult decision. I am proud to be a member of Springfield Township. I appreciate my neighbors, our family members, our board members, everyone who's put in time, a lot of time, as a result of this. So I just want to say how much I appreciate everybody's input, recognizing that safety is the single most important thing for our students. And the decisions that are being made, the decisions that need to be made, we know that this is not a perfect process. We know that there's more work to be done. We want to make sure that our parents have the support, resources, answers to some of the questions that they asked tonight about, scheduling and support for special education. All of those things are really, really important. So I think as a board, we want to make sure that parents have all of the support and resources that they could possibly have to answer their questions for what education is going to look like for our students moving forward. So thanks everyone, and just thank you.
Thank you, Ms. Jordan.
Dr. Taratusky, if I could make a
Sure.
comment.
Mr. Bedard.
At first, and this is off topic but important, I want to thank the student leaders on our NAACP group. They've continually been participating in our school board meetings. I love it. I want you guys to keep it up. We hear you, we see you. Look forward to further discussions at the multicultural meeting coming up in September. Now, onto the topic at hand. I'm going to speak plainly for a second. I want my kids in the school. I know everyone does. The survey says it, the comments say it. I moved to Springfield Township to get my kids into these schools. And this is just an awful situation. But it's a pandemic, and that's the situation. I want to thank first the parents and students and teachers that provided us comments. I swung by the rally today at the school where students and parents were urging school sports to happen. I appreciate the passion for that and the importance of sport in school. I read the petition that the seniors put together to urge us to get them back into school. Mm-hmm. I've read every email, talked to neighbors, considered the data, the science. And I just really appreciate all the input that we've had from the community. I also want to say thank you to Dr. Hacker for doing a tremendous job leading us, and to the administration. I know for a fact that you guys have been focusing on what matters. First, the safety of our students, our staff, our administrators. Second, to deliver the very best education possible to our kids. in any form that we can get that to them safely. And third, the social and mental development of our children, which has come up so much in the comments tonight. And I will make the commitment to the community that I'm going to continue to urge and prod and also support the administration to make sure that we're caring for the special needs children and any disproportionately impacted sets of students in our schools. It's so important. I do want to share two reflections from what I heard tonight. Dr. Coffin spoke so well about a concept that I hadn't heard articulated exactly how she said it, which is it's not just about opening schools successfully, but opening them successfully in a sustained manner. And that really struck me, and I'm going to share a quick personal story. I closed one of the offices of my business today because of a positive COVID exposure. I have the opportunity out in the private sector to have operational oversight, 7 offices for a company across 3 states and 5 counties. I've had to close 5 offices due to COVID exposure. And this is a tiny fraction of the number of people that will come into my offices. These offices are not open to the public, and I have exceptionally high control over the standards of safety in the offices. What I don't have control over is what happens outside those offices. And that is exactly the situation that our teachers and administrators would have to deal with. And for me, the most poignant comment tonight was from Mr. Rogoff, one of our drivers, talking about the difficulty of keeping our children safe, getting onto and on buses to get to the school. And I just can't see a path to us successfully in sustaining the opening of our schools until we've had more time to work with data and understand how we can get kids into school safely. So I will enthusiastically support Dr. Hacker's recommendation tonight.
Thank you, Dr. Bedard.
Oh, thank you for calling me a doctor.
I must be falling asleep. No, I'm sorry, I'm not. Mr. Bedard, but it sounded very doctoral. So, yeah. I apologize for levity in this very serious situation. I do want to reiterate and echo the comments of all my fellow board members. I don't want to take up too much time belaboring all of the points that have already been shared. But as I had stated in some of the emails that I returned to individuals who had sent them to me, we do have a commitment to transparency about what is the reasoning for the decisions that we're making. And this is a very important decision. The factors that I personally considered were, of course, health and safety recommendations. And if anybody who knows me and knows my work and my passion in the community, it is for our social and emotional and mental health of our students here in Springfield, as well as across the county. But mostly, primarily in this role, my focus is on students in Springfield. I too have a child who is a rising freshman. This is supposed to be a really exciting year for her. And she will be missing out on the opportunity to go into the high school for the first time this year. So that is a serious and emotional situation for me. One of the things that I do know from the mental health and emotional side is that children are resilient. And I think that is one of the pieces that I've been wanting to say all night. We do know that this is a traumatic experience for everyone. A pandemic has traumatized us all in many different ways, and everybody's the effects on everyone is individual. So we will never know how this truly affects each one of us. But what I do know is that we as a community are resilient, that our children are resilient, that our teachers are very skilled and supportive at what they do, and the things that we can control here in this situation, there's a lot that we can't control. We can't control health. We can't control the recommendations that are coming from the Department of Education. We can't control how the virus is transmitted, but we can control how we educate students. And so making the decision to educate students virtually is not a decision to close schools. I need to be very clear about that. We are not closing our schools. We are not failing to educate students if we educate them virtually. We are changing the mode of instruction, and we are doing it for a very good reason, to protect the health of the community that we live in and our families, our children. And we don't intend to do this on a permanent basis. This is going to be something that we will continue, just as we've done up till now, to depend on the data that we get from our medical professionals, the recommendations that we get from the Department of Education, the information that we're getting from our teachers and our staff and our administration. So this is not a permanent decision as we vote on this. And I think, as some of the comments came up earlier, it does not preclude us from looking at individual needs of students or students who are more at risk, and encouraging smaller, bringing kids in a smaller capacity. And I have talked with Dr. Hacker and other folks in administration about that, and we've mentioned that on the call today. So I want to be very clear that we are educating our children. We have a plan to do this safely, and we will continue to monitor the situation. And I do lend my full support to Dr. Hacker's recommendation. Are there any other comments from the board? Okay. And there is a motion on the table. Mr. King, can we do a roll call, please?
Yes, ma'am. Mr. Bedard.
Aye.
Mr. DeFranco.
Aye.
Dr. Atlin.
Aye.
Ms. Jordan.
Aye.
Mr. Lapidus.
Aye.
Mr. Needleman.
Aye.
Ms. Sarsfield.
Aye.
Ms. Slapinski.
Aye.
Dr. Taratusky.
Aye.
The motion passes.
Thank you. Number 2, Health and Safety Plan, recommended motion. The Board of School Directors approves the School District of Springfield Township's Health and Safety Plan for submission to the PA Department of Education. Attachment B. Is there a motion?
Motion.
And a second?
Second.
Thank you. Any comments or questions?
Dr. Taratusky, I'd just like to add that these plans are fluid. They can be revised or changed at any time. So as we move forward and we continually reevaluate our position, if we need to make changes to the health and safety plan that better reflect our current status, we'll be able to do that.
Okay, thank you. Any other comments or questions from the board? Okay, Mr. King?
Mr. Bedard.
Aye.
Mr. DeFranco.
Aye.
Dr. Atlin.
Aye.
Ms. Jordan.
Aye.
Mr. Lapidus.
Aye.
Mr. Needleman.
Aye.
Ms. Sarsfield.
Aye.
Ms. Slapinski.
Aye.
Dr. Taratusky.
Aye. Number 3, Student Transportation. Recommended motion. The Board of School Directors approves the resolution regarding the elimination of transportation services for resident students. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions? Okay, Mr. King?
Mr. Bedard.
Aye.
Mr. DeFranco.
Aye.
Dr. Atlin.
Aye.
Ms. Jordan.
Aye.
Mr. Lapidus.
Abstain.
Mr. Needleman.
Aye.
Ms. Sarsfield.
Aye.
Ms. Slapinski.
Aye.
Dr. Taratusky.
Aye.
Motion passes.
Okay. Number 4, Personnel. Recommended motion. The Board of School Directors approves the following personnel as presented in the attachment: certificated personnel, support personnel, temporary personnel, and extra pay for extra responsibilities. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions? Okay, Mr. King?
Dr. Taratusky will continue the rest of the motions as a voice vote.
Yes. Yes, thank you, Mr. King.
Okay, motion 4 has been read and seconded. All in favor, say aye.
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 All opposed? Motion carries.
Number 5, Camp Hill School Enrollment Contracts. The Board of School Directors approves the enrollment contracts between the Camp Hill School, Inc. and Springfield Township School District for the 2020-2021 school year for students 202-00818-01 and 202-00818-02. Is there a motion?
Motion.
And a second.
Second?
Any comments or questions? Thank you. Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? The motion carries.
Okay. Number 6, confidential settlement and release agreement. The Board of School Directors approves the confidential settlement and release agreement for student 202-00818-02. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions?
Sorry, was the second Mr. DeFranco?
Yes. Or Ms. Lipinski.
Have it.
Eeny, meeny, miny, moe. Gotcha. Thank you.
Okay, Mr. King?
The motion has been read and seconded. All in favor, say aye.
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 All opposed? The motion carries.
Number 7, anti-bias, anti-racism training. The Board of School Directors approves the contract with Dr. Crystal Lucky for anti-bias, anti-racism training workshops for the administration and staff, August 27th, 2020, for $1,500. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions? Okay, Mr. King?
Motion's been read and seconded. All in favor, say aye.
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 All opposed? Motion carries.
Number 8, trauma training. The Board of School Directors approves the contract with Lakeside Educational Network for $4,000 for staff training on the trauma-informed care for students on Tuesday, September 1, 2020. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions?
I missed that second again. I'm sorry.
Mr. Lapidus?
Yes, Mr. King, how could you?
I don't know how I could miss you, sir.
I know.
Okay, motion has been read and seconded. All in favor, say aye.
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 All opposed? The motion carries.
Number 10, number 9, Linkit renewal. The Board of School Directors approves the 2020-2021 software license agreement with Advanced Assessment Systems, Inc. for access to the Linkit Assessment Management and Analytics platform in the amount of $26,429. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions? Okay, Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? Motion carries.
Number 10, MCIU Joint Purchasing Program Agreement. The Board of School Directors approves the joint purchasing agreement with the MCIU Consortium to make joint purchases of materials, supplies, and equipment for the 2020-2021 school year. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions? Okay, Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? The motion carries.
Number 11, PSBA Insurance Trust. The Board of School Directors approves the agreement with the Pennsylvania School Boards Association Insurance Trust to participate in the Better Unemployment Compensation System Comprehensive Program, BUCS, for the 2020-2021 school year. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions? Okay, Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? Motion carries.
Number 12, Rico Copier Service Lease Agreement. The Board of School Directors of the School District of Springfield Township approves the 12-month lease extension agreement with Rico for copier equipment and to provide all supplies, parts, and labor for the monthly fee of $3,382.75. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions?
I do. For this type of expenditure in particular, and then perhaps at another time more generally, if we are not having students in schools for a period of time, and the needs for things like physical copies may be less, is there an opportunity to reduce our external expenditures just to provide some relief during these times?
Well, first I can say we have reduced the expenditures. We're saving just under $700 because we're extending the current lease because of the reduced utilization from the prior year on these copiers. These are not only copiers, but they are printers within our building. We do still have staff that comes into the offices and do need to print and do need to copy and things of that nature. So we were able to negotiate a reduction in the lease agreement per month of up to just under $700.
And Mr. King, just to follow up, is this a fixed cost on a monthly basis, or is it variable based on usage?
That is a fixed cost. If the usage is over a certain amount, we'll have additional charges, but we don't anticipate reaching those levels.
Okay.
Any other comments or questions? Okay, Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? And the motion carries.
Number 13, Wayman Fire Protection, New Enfield Elementary. The Board of School Directors approves the agreement with Wayman Fire Protection to provide central monitoring for the fire alarm and elevator systems at the New Enfield Elementary School for a one-year period beginning July 1, 2020 through June 30th, 2021 at the cost of $769 plus a fire alarm and elevator programming fee not to exceed $1,000 billed at a rate of $125 per hour. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions? Okay, Mr. King?
Motion has been read and seconded. All in favor, say aye.
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 All opposed? Motion carries.
Number 14, Field Remediation, High School. The Board of School Directors approves the agreement with the Field Turf USA, Inc. to provide field remediation for the high school stadium and turf field and multi-purpose turf field at a cost not to exceed $18,040. Is there a motion?
Motion.
And a second?
Second.
Any comments or questions?
I have a question. I'm curious, is there like a warranty item on this? Is this something that we can expect to happen every time we get a big rain? Was there, I don't know, is there some level where it's expected to survive a certain amount of water, whereas we had more this time around?
Well, there is a level, and we exceeded it.
Okay.
All that rain. That was a once in a lifetime, a lot of water rapidly. However, we as far as the warranty on the carpet, on the turf, not for this kind of issue. However, we are pursuing an insurance claim and hope that we'll be able to get some of this covered by insurance.
Thank you, Mr. King.
One other question is just on the timing of these repairs. Is it important to make sure that we do this in proximity to the damage in order to make sure that there's not future issues in terms of doing it now?
That I can't answer. If you're asking me, can we put it off and save this expenditure at this point? I would answer first, what we're trying to do is be prepared for the kids to come back from school and sports. When that is going to happen, we don't know, but the fields are going to have to be ready. There is damage and it's not going to get any better. So I don't know if more weather is going to have more of an impact. Some of the foundation, not the foundation, but the underlaying of the turf has been washed and moved. So we have to get that reset. So based on those two factors, wanting to be ready for the kids when they return, and the fact that I'm not sure if not addressing those concerns will have additional costs associated with it in the future, we thought that we would go ahead and move on this. And in addition to that, it's an insurance claim, so we want to get all of that process started as quickly as possible.
Good. I think what I want to do is make a comment here. I believe it's important that we get the field fixed. We made a big investment in the fields. My question was more related to whether or not we would have assurance on the insurance claim, and that could help us be more wide-eyed about this decision. My comment is, I think given the knowledge that when we do get kids back in school, and our intent is to get them into school as soon as we can get them in safely, we're going to have increased expenditures. And I want to just make sure that we are very thoughtful about anything that we could make choices on to either reduce or defer expenses so that we can better plan for the impacts of COVID. I agree that we need to get these fields fixed. I just want to make sure that that comment is on the record.
Oh, yes, sir. I would love to save money any chance we get. It also, if I may, add to my response regarding the copiers. We have to be ready. Although the staff will be utilizing that equipment, we also have to be ready for when the kids come back. We have to have the building and the equipment necessary, along with the fields, to do these things. There will be opportunities for cost savings, but I don't believe that this would be one of them at this time.
Mr. King, can I ask just a quick follow-up question to Mr. Bedars? And I think it was a really good question. Occupational hazard, I work for a lot of insurance companies. I know many of the policies prompt, you can question what that means, but prompt remediation is required. Is it required for us to get some kind of temporary fix in place so that insurance coverage stays in place?
I didn't pursue that on that one. When something like this happens, I immediately reach out to the brokers and we start looking at all the various policies and which pieces of those policies will cover this event.
Okay.
In order to get the facility and or piece of equipment or field back into service as quickly as we can, and start the process to try and save some dollars by utilizing insurance.
Okay. All right. I was just curious. Thank you.
Any other comments or questions? Okay, Mr. King.
Motion 14. Motion has been made and seconded. All in favor, say aye.
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 Opposed? The motion carries.
Number 15, policy 103.2, non-discrimination in school and classroom practices based on sex. First reading. Recommended motion. The Board of School Directors proposes the first reading of policy 103.2, non-discrimination in school and classroom practices based on sex, attachment C. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions?
Yes, I'd just like to make a quick comment that these two policies, one represents students, one represents staff. They're reflective of the new guidance that came out of the federal government regarding Title IX. All of our administrators just took the Title IX training that is required by the federal government for all of us to engage in. So we will be having a policy committee before we do our final second reading of this policy, just so that we can go through all of the accompanying paperwork on what the process is that is now required for any Title IX harassment or discrimination complaints. There's a whole new set of rules in terms of identification of individuals and what their roles are in any type of investigation of those complaints. I want to make sure before the second reading and the finalization of these policies that everyone on the policy committee and then the board is aware.
Okay, thank you. Any other comments or questions from the board?
Dr. Taratowski, can I make a comment real quick?
Sure.
Okay.
Mm-hmm. Yeah.
On this, and I alluded to this a little bit before, we're in a little bit of a bind because funding is tied to the adoption of this policy. Secretary DeVos, whom Dr. Hacker referred to earlier, has done nothing but make this harder. She has made it easier for kids to get harassed and bullied and assaulted on schools at every level. So while I feel as though I have to vote for this to ensure that our district gets what it needs, it is, what did we say when we were playing as kids? I do this under protest. That's it. Thank you.
Thank you, Mr. Needleman. Are there any other comments or questions? Hey, Mr. King?
Motion has been read and seconded, and all in favor say aye.
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 All opposed? Motion carries.
Number 16, Policy 104.2, Non-Discrimination in Employment and Contract Practices Based on Sex, first reading. The Board of School Directors proposes the first reading of the Policy 104.2, Non-Discrimination in Employment and Contract Practices Based on Sex, Attachment D. Is there a motion?
Motion.
And a second.
Second.
Any comments or questions?
Dr. Taratowski, I just want to reiterate my comment from before. It applies to this as well.
Thank you, Mr. Needleman.
I vote affirmative under protest.
Understand. Okay. Any other comments or questions? Mr. King?
Motion has been read and seconded. All in favor say aye.
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 All opposed? The motion carries.
Okay. Are there any public comments on non-agenda items? Okay. Ellie joined us earlier, and we had asked her to wait, and she was extremely patient. So let's invite Ellie in, and we appreciate her patience through this whole entire meeting. And let's hear what she has to say.
Hello, my name is Ellie Lynch. I'm a student at Springfield Township High School, and I recently joined the NAACP Youth Leadership Group. While this is my first time attending the board meeting, my group members have expressed frustration after 3 months of pushing for the infusion of African American history into our school. The school board has been slow to act when it comes to improving our education, which is the only way to truly dismantle racism in our community. There are other members of our group present tonight that would like to speak on some of our concerns as well. Thank you.
Thank you, Ellie. Candace Harrison?
Hello, my name is Candace Harrison and I live in Orland, Pennsylvania. I'm an incoming sophomore at Springfield Township High School, here with the NAACP Youth Leadership Committee. We recently made a petition for African American studies to be infused into the school district of Springfield Township. We've done very well. We have over 580 signatures. Here are the demands that we're making of you. Montgomery County is asking that African American history be taught in school as an equally valuable discipline to what currently exists, which is essentially European history with African American history barely talked about. Specifically, we are requesting the following for the 2020 to 2021 year. For the 20 to 21 school year. Number 1, the infusion of African American studies into the K-12 curriculum of the Springfield Township School District. Number 2, the African American Studies elective, which begins in the fall at the high school, to be made into a full credit course. Number 3, this class should be taught by African American teachers with subject matter knowledge in the discipline, not only because they have expertise, but also as an opportunity for the district to recruit more Black teachers. Today, racist scenarios are emerging more and more due to ignorance. To prevent such occurrences from happening, we need your help and support by signing this petition for the implementation of African American history. We're asking for these demands to be recognized, acknowledged, and acted on. Next up, we have other associates from the group commenting on another issue we'd like to address. Thank you for your time.
Thank you, Candace. Joshua Williams.
Joshua Williams from Orland, PA. I'm also a member of the NCYL. Basically, the comment I wanted to bring up is that we have been to several of these board meetings from the beginning of the summer. And in a lot of these meetings, we have been told that we can save our points basically to be the end because at the moment they're considered non-agenda issues. Personally, I feel as though with us being in a continuous cycle of heightened racial tensions, misinformation, and also just anger and pain, especially from the Black and minority sect of Springfield students, the fact that this still continues to kind of remain a non-agenda issue is kind of troubling. And for me, I think what we're really seeking is to see our initiatives be placed as agendas in front of the board to be voted on. And the reason for that is predominantly because we understand that what this board has the power to do is to determine what is priority that the teachers have to take in a sense of training, learning, or the restructuring of our educational system. And while I 100% commend you guys for one, just the dedication shown by being on this call for almost 3 hours now, and the fact that you guys have voted on something to deal with like biases and interpersonal racism, I would challenge the board to also take that extra step to put in a motion that affects the structural way we teach school, because the way we do it currently is truly letting down our children. I know COVID has kind of made this environment kind of difficult to think about how to teach, but as we rush to consider where we're going to teach our children, I also think that it's paramount that we do not lose sight of the importance of how we teach our children. And if we are misinforming them, if we're neglecting and marginalizing the experiences of many of them, then I feel as though we're failing them. And we have brought this, like I said, to the board several times. And for me, I'm not inferring or assuming that this is the case, but oftentimes when we come to the board, it does kind of feel like a pat on the head in the sense of like, oh, this is a nice thing that you're doing. But again, it is a non-agenda issue. So as I said, I would prefer to see these things brought up as a non-agenda issue. And to some capacity, I feel as though the board is slightly waiting for the fervor of this moment of racial tension to dissipate so they can deal with it at a later time. But I just want to reiterate, this current racial tension that we're seeing in the world, it's not a moment. This is a legacy of America that this board does have the power to somewhat impact through the improvement and betterment of our education system. So again, I'm urging that you hear our concerns, our demands, and within a future date, making some of our initiatives actual voted on agendas that are motioned within this board. Thank you.
Thank you, Josh. Gabrielle Green.
So I would just like, I'm Gabrielle Green, by the way, sorry, I'm Gabrielle Green, I live in Orland, Pennsylvania, and I would just like to say, in conclusion, as not only board members, but members of our community, we urge you to do your part by supporting our cause. We urge you to take our concerns seriously and not only tell us with words, but show us with action. We appreciate you giving us a platform to speak, but becoming agenda items will solidify our movement. Part of your motto is that the board is committed to educational mission of the district, which demands educational excellence for every child. Teaching African American history correctly and accurately ensures academic excellence. It is more important now than ever to be aggressive and make a change and establish equality. It starts with education. We challenge you to show the community how far you are willing to go to make all of your students feel safe, comfortable, seen, heard, and represented. Sincerely, the NAACP Youth Leadership Committee. Thank you.
Thank you very much, Gabrielle, and thank you to all the youth leaders who spoke at the meeting. I will echo Mr. Bedard's comments from the beginning of the meeting that we do hear you, we do see you. There are forums for addressing the curricular concerns, and Dr. Hacker, you can if you can just elaborate on that a little bit, because I do believe when we do make changes to curriculum, those are agenda items in terms of adding courses and changing curricular materials, books, and things like that. So those will be agenda items as those changes are made. Dr. Hacker, do you want to add?
Yeah,
anything?
first of all, thank you, Ellie, Candace, Josh, and Gabby. We do greatly appreciate your coming before the board and sharing your thoughts with all of us and pushing for what you believe is important and what we all believe along with you is important for our staff and for our student community as well. It's my understanding that Dr. Yannicone, our assistant superintendent for curriculum instruction, actually did meet with your group, with Dr. Rittenhouse and Mrs. Zahner, who is the chair of the social studies department, and based on what she has shared back with me, provided your group with information about the curriculum review process, the steps that they had taken so far. Mrs. McCaslin may have been in that as well as a representative of the English Language Arts Department. They both were able to share with you progress that has been made in terms of examining the way history is portrayed in social studies and also the novels that we are using and how we have diversified the texts that we are studying in English language arts. So, you know, I just want to remind you that your requests have not gone on deaf ears. You had two significant administrators from the school district as well as two department chairs who met with you after the last board meeting when you came forth and expressed your concerns. They immediately put a meeting into motion in order to talk to you and to listen in more detail. So we are all truly invested in what you have to say. And as Dr. Taratuski mentioned, just as a point of clarification, those kinds of issues do come before the board. So when we approve the African American Studies course, which is, by the way, taught by Mr. Len Thompson, an African American man, for this fall, that was brought before the board for school board approval, and it was brought before our Academic Affairs Committee, which is normally the vehicle by which those things are presented, reviewed, discussed, and vetted before final board approval. Anytime we revise curriculum or develop new curriculum or approve new textbooks, and I know a textbook that you had brought up, there was some concern about that was brought up at the last board meeting. That's also discussed through our Academic Affairs Committee as well as in our particular departments. And then any changes are recommended to the full board and become agenda items. So I think you've seen some evidence that you are in fact being heard. We listen to our staff as well in terms of what their needs are. And as you saw the agenda item on tonight's board meeting with Dr. Lucky, a portion of her time, very critical when she is coming in, is going to be spent discussing the recent events that have taken place since the killing of George Floyd, and he by no means is the only individual, obviously, that we have concerns about in terms of violence against Black men and Black women. So that is going to be a key point of her discussion with staff members and helping them to talk about these issues, as well as how to handle these issues with students when they come back to school. So we take all these things very seriously and we implement them. And I think that things do take time. We can't implement everything at once, but we are taking steps to make that progress.
Thank you, Dr. Hacker. I don't see any more speakers at this point. So future meeting dates, we have an interim board meeting on Tuesday, September 1st, 2020 at 7 p.m. It's a virtual meeting, and a regular board meeting on Tuesday, September 15th at 7 p.m., a virtual board meeting. There are committees of the board. They include academic affairs, finance, property, and policy. At this point, there are no board committee meetings scheduled. Those will be determined as we start into the school year. And we do appreciate the 93 attendees who have stayed on with us for the 3-hour meeting that we've had. And we do appreciate the comments of everyone that attended this meeting, their patience, their understanding, and I just want to fall back on Gretchen's comment that I hope that as we move on from this board meeting this evening and into our school year, that we remember as a community to be kind to one another and to support one another through this as we move into the challenges of a new school year. Thank you all.
Thank you, everyone. Thanks for hanging in through a long board meeting, and we'll do our best to move forward as best we can.
Thank you.
Thank
Thanks,
you.
everyone.
Take care.
Good night.
Good night.
Good night, everyone.